Good morning, everyone, and I would like to welcome every one of you to the day second of first Cooperative Youth Research Conference. And today we'll be having four sessions. And today, this is the technical session too. Yesterday we had two presentations. And today we'll be having the four technical sessions. Each session will have three presentations. I hope the rules are clear to everyone. But I'll still repeat that you will be judged based on four criteria. First, your research paper, the quality of research, then the application part of your research, then how are you presenting and how are you answering the questions. That will sum up to 100 marks, and you will get 15 minutes to present. 10 minutes, you can, 10 minutes, on 10 minutes, a bell will ring, and then in 5 minutes, you have to wind up your presentation, and then 5 more minutes will be given to ask the questions and discussions. So in totality, 20 minutes, 15 minutes of presentation, and 5 minutes of question and answer. Okay, all the very best. And today we have the very best presenter is Dr. Bhumat Shah, who will be presenting on health cooperative as a path to accessible and affordable rural healthcare, a framework for sustainable development of healthy India. Welcome, Bhumat. Over to you.
Respected Professor C. Pichai sir, Sanjay sir, Rajiv sir, Srijama, and all dear participants from the different parts of the country. A very good morning to one and all. I'm Dr. Bhumit Shah, Assistant Professor at the Maharaja Sayajirao University of Baroda, Department of Cooperative Management and Rural Studies, Faculty of Commerce, the Maharaja Sayajirao University of Baroda. So my topic is Health Cooperative as a path to accessible and affordable rural healthcare, a framework for sustainable development of healthy India. This is the outline of my presentation. So I'm moving forward for this slide. Yes, after independence, the government of India giving a lot of importance to the health sector. One of the slogan that we all aware about, that is health for all and all for health, which was given by the World Health Organization for achieving the universal healthcare standards, especially at the grassroots level as well as for the weaker section of the society. Government of India have been already set up with the few committees like a Bhore committee, Shore committee, Kartar Singh committees, and Mudliar committees. And these all committees have already given their recommendation for achieving the quality of healthcare, especially at the grassroots level as well as for the weaker section of the society. One of the flagship program that we all aware about, that is Ayushman Bharat, which is going to be providing the affordable rural healthcare. And even one of the sustainable development goals that is all we are aware of, especially after the COVID-19, that is a good health and well-being. And for achieving at the affordable rural healthcare, yes, definitely the health cooperative are a user-owned management organization offering healthcare services and representing as a viable pathway and enhancing the accessibility, affordability, as well as the best quality healthcare services at the rural level. Yes, this is one of the Times of India recent article. As you can see, we are into the year of international year of Cooperative 2025, and this is one of the flagship program that tags as Pradhan Mantri Bharatiya Aushadhi Yojana, which is one of the recent initiative under by the Ministry of Health and Family Welfare. This is the literature, it is going to be there. So few studies have been already conducted in the past, and it's clearly indicating that the health cooperative, which is going to be providing the quality of healthcare services, especially to the rural people. Few other studies, it's also indicating that the certain challenges will also going to be faced by the health cooperatives. And few studies, it's indicating that the implementation model which is missing in the earlier studies. So research gap have been identified that various models which is missing for especially health cooperatives, and even one of the issues that earlier research is clearly indicating, that is the awareness regarding the health cooperative which is missing. This is the research gap have been identified, and they are clearly indicating that the practical knowledge and theoretical gap knowledge has been found.
in the earlier research, because they have given the conceptual clarity regarding the elements of health cooperatives and the certain challenges. So I'm explored area and the dimension which I have covered in my research work, considering and try to provide the various model considering the health cooperative, which is definitely it is going to be the game changer for the rural people for providing quality of healthcare as well as the affordable rural healthcare. These are the objective. These are the objective of my research study. So the primary objective of the research study is to provide the conceptual framework at the same time to conceptualize the key aspect of health cooperatives in India. Also considering the current status of the health cooperative at the national level, at the same time the global level. Again, they also emphasize on the providing the key linkages between the health cooperative at the same time the sustainable development of India. Healthy India, that is very important. And also the research is highlighting to provide the various models for achieving the affordable healthcare, especially. Yes, the methodology part, yes, the research paper is based on the secondary data. I have referred the government report, ministry reports, a few journals. Again, the attempt has been made to conceptualize the key aspects of health cooperatives in India and also to find the key linkages between the health cooperative and sustainable development of healthy India. Yes, this is the current scenario of rural healthcare system in India. There is a three-tier rural healthcare structure which is currently presently available into the India. The top level, the community health center with the 30-bedded hospital. Specialized doctors are available. That is considering surgeon, doctors, at the same time obstetrician, gynecologists, pediatrician, primary health center, that is 56 beds are available in the rural area, considering one medical officer at the same time treating paramedical staff. And another, there is a sub-center considering one female health worker at the same time one male health worker it is there. So this is the current scenario for the budget allocation, which is clearly indicating that the Ministry of Health and Family Welfare focusing on the various aspects like affordable healthcare at the same time, accessible healthcare, and the budget clearly indicating 91,000 crore which is given to the these ministries. And yeah, yeah, is it fine? Oh, fine. Yeah. So this is one of the budget allocation, which is clearly indicating that last year, that is a 11% rise, which is into the Ministry of Health and Family Welfare. This is the population norms. So it is very interesting fact you can see if there is a 30,000 population in the rural area, you will get one primary health center, and the hilly area there is a 20,000 population. If it is there, you will get the one PHC. As according to the sub centers, at the same time the community health center. This is the population norms. Yes, what is a health cooperative? Now, very important, the health cooperative, it is the member-owned organization where the patient, healthcare providers, community members are jointly and collectively in providing the medical services to the members. And again, very important, yesterday's the keynote address by the Sudhir sir, even the Pichal sir, and even very important, my dear Yogesh sir, that collective approach and joint collaboration, which is helping to make the possible affordable rural healthcare. This is the concept. Yes, different types of health cooperative which is available currently. That is a consumer health cooperatives, provider health cooperatives, hybrid mode health cooperatives, community-based health cooperatives, and at the same time the purchase and share cooperatives. So these are the different types of health cooperatives there. These are the various advantages, as you can see. The delivering the smooth healthcare services, managing the healthcare facilities, offering the health infrastructure, providing care especially to the rural people, promoting the healthcare education and awareness, which is missing especially in the rural area, and delivering the pharmaceutical services and medicines, very important. So earlier slide, which is Pradhan Mantri Aushadhi Yojana, which is providing the free medicines. These are the various models. So this is a major contribution in the research paper. The first model, which is model for sustainable development of health cooperatives through rural primary health centers. So we are into the umbrella of Government of India, and we are both ministries are working, Ministry of Cooperation and Ministry of Health and Family Welfare, under which the health cooperative is working into the Ministry of Cooperation, and rural primary health center which is working into the Ministry of Health and Family Welfare. This collaboration, which is going to be the drastic change for providing the best affordable rural healthcare, especially to the rural people, which leads to sustainable development of rural India, considering the primary health centers, which is providing the medical services, at the same time, the certain extended services like health insurance, awareness regarding the nutritional health, which is going to be covered into the health packages. So this is the first model which is considering the primary health centers. This is the second model, the model for sustainable development of health capable through non-governmental organization. Why this model? Just because the primary health center, which is not available at the every villages. So this is one of the second model I've been developed, considering the Ministry of Health and Revenue Welfare organizing the various government programs and schemes. And NGO will definitely going to play a crucial role regarding the awareness campaign, donations, funding. And again, this is going to be very important for achieving the affordable rural healthcare and sustainable development of India. This is the third model, that is the overall sustainable development, achieving the universal healthcare standards, especially at the health. So you can say these are the various elements considering the healthcare cooperatives, funding, community engagement, professional expertise, collaboration, access to healthcare, and yes, definitely the doctors will be gone for the rural people, especially. At the same time, the various implementation healthcare service, how the process will be going to consider strengthening the local healthcare system, making the healthcare affordable at the low income population, capacity building healthcare services, change to the United Nations, that is a for all and all purpose, for affordable and accessible rural healthcare which can be achieved by the particular model. Yes, ICHO, International Health Cooperative Organization, that is a sectoral organization, and which was established 1996, and it comprised the National Apex organization, and considering the cooperative enterprise involved into the health promotion, health literacy, health insurance, hospital management, and many more. This is the current status at the global level. As you can see, the USA, Canada, Colombia, Nepal, Turkey, that are making a remarkable progress. The USA with the certain two different health cooperatives, there is a health partners and group health cooperatives. In Canada, yes, there is a food services which is provided through the cooperative. Whereas the Colombia, which is going to be stand for the providing the employment opportunity through the cooperative. Schemes have been implemented, especially to provide the healthcare at a low budget. Another is the there is a pharmacy cooperative which is providing the medicine to the needy. This is one of the changer in the Japan, that is the history of Japan, that is the honorable people, they covered and provide the best possible healthcare services at the affordable rate. So this is the global level. This is the current status of healthcare cooperatives in India. Yes, the total 52 cooperative hospitals, which is available at the Maharashtra, Karnataka, Kerala, Andhra Pradesh. So they comprise this, and recently the Dehradun district of Bengal developed the cooperative facilities. And yes, one of the important that is in Gujarat, yesterday's presenter clearly mentioned about the everything, that is a SEWA, which is also one of the providing the best possible standard. This is the current statistics of the healthcare cooperatives in Kerala. So earlier slides, I have mentioned the 4 states. So remarkable progress have been made by the Kerala state, that is a cooperative dispensary. As you can see, the total 84 district cooperative hospital, that is a 14. At the same time, medical colleges, at the same time, ROV hospitals. So this is the current statistics of the Kerala, as you can see in this slide. Yes, this is another scheme, that is a Ayushman Sahkar scheme. The scheme aims to provide the financial assistance to the cooperative hospitals, enabling them to expand their educational offerings and contribute to overall development of the healthcare services. Another, these are the various objectives of the schemes. So offering the comprehensive, reasonable price healthcare through medical facility, at the same time support the cooperative group to affect Ayush service, achieving the national health mission. And another important scheme which has identified, that is a national digital mission, which is a holistic and comprehensive digital health ecosystem that will establish a strong public digital infrastructure, empowering individuals, including the patient, doctor, health facility, and streamline delivering to healthcare services. And by participating into this mission, cooperative can leverage the digital technology, which is also very much required, as we all aware about the concept, the telemedicine, which is very important in this area. These are the problem-solved solution which is available. That is a lack of skill and trained healthcare personnel. So thereby we invest the more continuous training educational program, dominance of the private sector healthcare. So public-private partnership model can be possible. Yes, we can be collaboration between the health sectors and the particularly private sector. Another limited budget for imparting the medical sector below in decision making. So strong management can be required. This is also another problem well solution. Shortage of trained and skilled healthcare at the same time promote the healthy collaboration and culture of collaboration in the cooperative that is very important. And another government shortage of resources. Definitely, CSR funding is also going to be the huge role to make the cooperative sustainable. This is the answer to the question that very important how we can achieve the accessible, affordable, high quality care. So this is very clear as already the progressor says in his research, in his presidential address. The collaborative approach that is very important, strong governance, at the same time the involvement of the members very important. We considering the primary goal that is affordable, accessible healthcare. So this is the conclusion part. Yes, we can achieve the collaborative approach. Very important. We are into the year, international year of cooperatives. So the affordable, accessible rural healthcare can be achieved with the collective approach, not individual, not government, not only cooperative, but it is everyone effort and collective approach that is very much needed, as we are the people of cooperation. Should not forget it is of the people, for the people, and by the people movement. And very important that Viksit Bharat 24/7 Sahkar se Samriddhi help for all, which can be achieved only with the help of collective approach, which I have shown earlier the slide, and this is the answer to the particular question that the collaborative approach can make a significant impact. These are the references which I have used for my research work. Thank you.
Thank you so much, Dr. Mohammed Shah. I would now ask our expert panel to please ask their queries.
Yeah, Dr. Bhumisha, it's a very good study, in fact, I have to say, because this is need of the hour.
Absolutely.
There are a number of good things I have to say. One is about the types of health cooperatives you have listed. And second one is that you have listed the models, different models also. That's a good thing. But basically, when you have come out with the literature, what is the gap you have identified? Basically, you are now, it's a research paper, Yeah. So in that case, what is the gap you have identified out of the literature? That's one part you have to say.
Yes.
Second part is that now you are suggesting some models. There are a number of models that are existing in different parts of the country, particularly in Kerala, if you take, that is the state which is leading in the health cooperatives, right? So in that case, we can just find out what is the positive pros and cons of the cooperatives that are existing in Kerala or in Maharashtra and other places. But when you take the number, Kerala stands first, and then the services are also good. So in that case, we can just come out with that whether the model already which is existing, which model, what is the plus and minus, and then what is the suggestion we are making for us. If that is presented, surely this would have been much better.
About the research gap, few studies, earlier studies, they have covered regarding the basic aspects regarding the health cooperatives. At the same time, what the role which is played by the health cooperatives. So they have not suggested the various model that how health cooperative can be implemented. So that is why I have considered the rural primary health centers, at the same time the NGO. So both I have taken for the collaboration with the health cooperative, which is going to be the game changer in the rural area. As the first model, I have already given into the particular research paper. There is a limitation of the first model as in entire India, in every state, the primary health center which is not available at the every villages. There is only sub-centers. And sub-centers itself having the limitation, not having the specialized doctors. So the collaboration, which is very important for the rural primary health centers and health cooperative. So this is the gap which I have identified, and this first model I have given to this. Another model, which is especially where the villages which is not having the primary health centers. So the role of non-governmental organization, it is going to be very crucial. So this is the gap which I have identified. That is the practical knowledge and conceptual. These the model knowledge gap appears in the earlier research that I have covered into my research study. So the second, you have clearly mentioned, yes, the Kerala is leading in the area of healthcare. Yes, and sir, even in the Kerala, yes, the model which is already available, but this model which I have given to the in this particular research, this can be possible where in the Kerala rural areas when if it is no primary health center available, then definitely it is a Brahmastra which is going to be applicable, the first model, which is very clearly indicating that health cooperative and primary health center, if they come together, which is going to be the game changer for the rural people. So this is going to be the model which I am looking for. And yes, that is the collective approach which we needed. So this is
Actually, the model which you have mentioned, that primary health centers, you could have elaborated it more like that, how the health cooperatives can be set up there and what type of collaborations they have with the, NGOs can have. So you could have dealt more about this model. And in the other part of the research, you have mentioned about other issues like that. So you could have not mentioned, but if you could have given full focus to this model like that. There are so many areas which you have covered like that.
Yeah.
How to help set up the health copy. You simply say that there should be collaboration between the primary health centers and the health cooperatives with NGOs. But you could have given more, in-depth analysis of the whole thing. Then it could have been far better like that.
Even I have one suggestion. See, yesterday also I was telling, and today also I'll repeat the same thing. When you are doing a research, whether it's a case study or model-based comparison based on anything, you have to have some research objectives. And then you had, but there was no methodology. You didn't compare the models. And if you compare at all, then on what parameters? Who were your respondents? If they are, suppose there is primary healthcare center and then you have cooperative healthcare and you are comparing the model or then you are amalgamating them, then you should have some indicators to judge whether the health cooperative is better or the primary healthcare services are better and how we can amalgamate them. So at least some indicators, some analysis, some respondent to ask questions from, some questionnaire based only, but some analysis, some part of this should be there because it's a research thing. This is simply a review, I tell you.
Yeah.
It is not a research paper. From my perspective, it's not a research paper. For research paper, you had to have a methodology, some analysis, some conclusion you would draw out of it. You cannot simply say that, okay, this model has come up and now we can do like that. If you have to say something, you have to come to a conclusion, then you also have to study that. Okay, there was a village or there was a city where primary healthcare services was there, and it was then amalgamated by healthcare cooperative, and then together they did wonders on these parameters. So this could be an approach for a study when we take a healthcare cooperative study or any study, I tell you.
Should I?
Yes, please.
So, ma'am, actually, you and sir have almost the same question. So this is the conceptual review paper. Yeah. But every model which is required the analytical perspective and every model should be measured. So this is just a conceptual idea that I have developing for my research work. And this is, yes, absolutely. It is a review paper that you have covered. Yes. And every model which required the detailed analysis.
Yes.
Yes. So this is just my conceptual review idea paper and the model. And sir already suggested the certain parameters. So I covered into that particular parameters and every parameter can be measured.
Yes.
And this analytical and empirical study can be done into a particular analytical paper. So this is the conceptual model which I have developed, and every model needs a detailed analysis. So this is the review and conceptual paper. So thank you, ma'am. Thank you.
Thank you so much,
Thank you.
Moment. Next, we have Dr. B. Krupashri, and she will be presenting on topic PACS as multi-service centers with an emphasis on healthcare services. Let's welcome B. Krupashri.
Good morning. Yeah. So my topic is PACS as multi-service centers with an emphasis on healthcare services. No, it's different.
Whoever are next in row, get your presentation done before the presentation finishes. Get your presentation done there prior to your presentation. And next will be Deepshika. So before she will be present, after she will be presenting, you just go there and check whether this is your presentation or not. Just play Deepshika's presentation. Sorry for the technical issue here. Our third presenter will be presenting now. She is Thakur Deepshika Virendra Singh, and she will be presenting on topic empowering grassroots, cooperatives paving the way to India's $5 trillion economy and United Nations Sustainable Development Goal achievements. Welcome, Deepshika. Over to you.
Thank you so much, ma'am. A very good morning to distinguished panelists as well as my co-research fellows. May I have the presentation, please? So, the presentation title is Empowering Grassroots, Cooperative Driving India's $5 Economy and Universal Sustainable Development Goal, a study of SEWA Bank Nadu.
Okay, thank you.
So, considering the SEWA Bank's model, I have taken the SEWA Bank's model for the study of this topic. The reason is when I work at the grassroots level, I find that women's participation in cooperative sector is lacking. If I talk about the total data, totally there is 8.5 lakh cooperatives in India. Cooperative are adverse.
Okay. So 48.44% are females. While if I compare the same with Nepal and Bhutan, which are our neighboring countries, 51% women contribution is there.
in cooperative sector. So I find that this is the major gap in our nation, and if this gap is removed, we have that caliber, that $5 trillion economy as well as Viksit Bharat, and we can also fulfill the United Nations Sustainable Development Goals. So considering that, okay, please help me with. So here I have taken the study of Shri Mahila Seva Sahakari Bank Limited. The journey of the same started in the year 1974, wherein it was observed that the females are facing the financial crisis. And whenever they want to start any cooperative or want to do any kind of business, the finance is lacking. And as finance is considered as the lifeblood of business or a cooperative, this was the major constraint. So over here, to promote the savings, to help women with the cooperative sector and to form more cooperative sectors which are women-led, SEWA Bank's contribution played an eminent role. So after the formation of this SEWA Cooperative Bank, currently the data are like 5.6 lakh customers and growth, demonstrating the widespread impact is there by the SEWA Bank, and it is operational in only in Gujarat. So I think that if this model gets applied all over the nation, if we learn from this model, then we would be able to meet that gap which is there in India. Then 50 plus years are completed of dedicated service empowering women and transforming lives. 13 banking outlets across 6 regions in Gujarat are observed. And for vendors, for laborers, small service providers, as well as home-based workers, this bank is like a blessing. So with the formation of this bank, the Sustainable Development Goal 1, poverty eradication, then gender equality, Sustainable Development Goal 5, economic growth, Sustainable Development Goal 8. Additionally, the cooperatives focus on reducing the income inequality, Sustainable Development Goal 10. So through this model, these 4 different sustainable development goals can be achieved. Now the need for the research, why the need arise? So it highlights the effectiveness of cooperatives in addressing that financial gaps which women are facing in India, provide the empirical evidence on the role of cooperative model for the sustainable development, advocate for policy measures that support cooperative financial institutions, encourages the replication of successful cooperative model across the other sectors and regions. Here I would like to quote one shloka of Sanskrit, wherein it is mentioned that yatra naryastu pujyante ramante tatra devata yatra krita stribhya pujya tadya brahma prasidati, which means that where the women are revered, there the God rejoices, where women are worshipped, that family flourishes, where women are respected, their country prospers. So over here, such kind of banking model can definitely prove to be very effective when we want to serve that gap of women contribution in the cooperative sector. Vision behind doing this research was to showcase the transformational impact of cooperative banking on women entrepreneurship and financial inclusion. It provides the insights into the scalability and operational efficiency of cooperative financial models, foster a discourse on integrating cooperative frameworks into India's broader economic and policy framework, offer recommendations for strengthening cooperative institutions to enhance their reach and impact. The objectives of the research stand to examine the impact of cooperative banking in empowering self-employed women in the informal sector, to analyze the financial growth and sustainability of SEWA Bank. I have taken 3 financial years study to explore the role of cooperative in achieving India's economic goal as well as United Nations Sustainable Development Goals, to identify challenges faced by the cooperative financial models and strategies for scalability and effectiveness, and to assess the socio-economic transformation enabled by SEWA Bank's financial inclusion initiatives. SEWA Bank is not only engaged in lending deposits and providing gold loans or other things. It is also providing entrepreneurship development program trainings to the females at the grassroots level. It is also engaged in financial literacy training programs which are provided to the women at the field level. Here the methodology which is applied over here is the case study approach. The research centers around the SEWA Bank to exemplifying the impact of cooperative on the empowerment and alignment with India's 5 trillion economic goals and United Nations Sustainable Development Goals. The comparative analysis is done of financial and operational data of SEWA Bank over 3 financial years. The data collection, here the primary and secondary data are taken, wherein I did the interview and focus the group discussion and observation with SEWA Bank members to understand the experiences, the socio-economic changes which has taken place. And as per the yesterday's discussion, that we need to focus on the social capital, human capital, and the collaborative approach. So over here, I did the discussions with the SEWA Bank's members as well as at the grassroots level when the financial literacy training programs were conducted. I personally went there and I did the discussion how it is making that positive impact. Then in the secondary data, financial statements and reports from SEWA Bank and policy documents and official report on United Nations Sustainable Development Goal and India's economic target were studied. Analytical framework, the quantitative analysis was done, evaluation of key financial indicators such as the total deposit, loan disbursed, working capital, and profit margins. The statistical tools are used to create visual representation, bar chart. Then qualitative analysis was done, thematic analysis of interviews and focus group discussion to extract insight, analysis of SEWA Bank's alignment with United Nations Sustainable Goal to highlight the contribution and poverty reduction, gender equality, and financial inclusion. Key evaluation metrics were the economic impact. Like yesterday, we discussed that what's the impact of the research, how positively we can contribute for the same. So here the economic impact was studied, wherein the assessment of income generation, asset building, and financial independence among members was studied. The social impact was also studied, wherein the examination of improvement in the quality of life of women, the autonomy and community participation was done. Alignment with United Nations Sustainable Development Goal. So evaluation of SEWA Bank's contribution to United Nations Sustainable Goal. Number 1, like poverty reduction, then gender equality, goal number 5, and economic growth, sustainable development goal 8. This is the study wherein I have taken the data of 2021, 21, 22, and 2022 and 23. The data of the shareholder, share fund, total deposit, working capital, loan accounts, loan and profit. Here the comparative impact analysis is done, wherein we can see that there has been a constant increase in the number of shareholders. Growth in the shareholders can be seen. Here, the growth in the total deposit of the SEWA Bank can be observed, which has proved to be effective. And it has brought a revolutionary change in the economy of Gujarat. And SEWA plays a very remarkable role in the cooperative sector, whereas strengthening of women participation in cooperative sector is concerned. Here, the loan disbursed by SEWA Bank, they have also constantly improved, and due to this effort, many females who wanted to do the startup of their cooperative for khakra making or for healthcare cooperative or like handloom and handicraft cooperative they wanted to open. So this bank has provided them a sufficient amount of funding, and due to this, the female participation in the cooperative sector has improved. This is the profit growth study, wherein we can observe that SEWA Bank's profit grew from 1 crore in 2020-21 to 2.18 crore in 2022-23. It reflects the overall increase of 118% over 3 years. Even through this, there is an alignment with the United Nations Sustainable Goal number 1, no poverty, then goal number 8, decent work and economic participation. It is also supporting India's contribution in $5 trillion economy vision. So results of the research were SEWA Bank has significantly contributed to financial inclusion, increasing the deposits and loan leading to economic empowerment of women in the informal sector. The bank's financial indicators show steady growth from 2020 to 2023, proving the sustainable model. Cooperative banking fosters economic independence among reducing dependency on informal money lenders. This was the major issue before such kind of banks got established in the cooperative sector, that the females used to take loan from the money lenders and the interest rate were very high, and there was a lot of problem. And after the formation of such kind of banks, this problem is resolved, and women are flourishing in cooperative sector. SEWA Bank aligns with United Nations sustainable goals such as poverty eradication, gender equality, and economic growth. Challenges remains in scalability, resource limitation, digitalization among the cooperative sector. Financial literacy programs have enhanced women's decision-making capabilities, contributing to long-term economic stability. SEWA Bank's approach can be replicated to strengthen grassroots financial institutions nationwide. Now, applications of finding. Policy development. So, policymakers can use this research finding to draft a regulation that promote cooperative banking as a viable financial inclusion model. Scaling a financial inclusion initiative, the success of SEWA Bank can serve as a blueprint for establishing similar cooperative banks in other regions also. This is only there in Gujarat. So we can implement such kind of models in 28 states as well as in the union territories, which will help to strengthen women empowerment at national level. Enhancing microfinance programs, the insights can inform the decision of the schemes that cater specifically to women entrepreneurs in the informal sector. Educational program and training. A financial literacy and cooperative training program can be developed based on the findings to empower the participation of the women. Investment and funding strategies. Banks and financial institutions can leverage the study to access cooperative banking potential as an investment avenue. SEWA Bank's role in economic transformation. By enabling women's participation in the economy, a SEWA Bank contributed in increasing household incomes and aggregate demand, directly fueling the GDP contribution. Additional contribution include supporting local supply chain through micro businesses, building financial resilience among rural population, facilitating skill development programs tied to cooperative ventures, serving as a replicable model for other regions and sectors. Technological adoption in cooperative sector. So it supports the integration of digital banking solutions to increase the efficiency, corporate social responsibility initiatives. Private corporations and NGO can incorporate cooperative banking support into their CSR strategies to enhance socio-economic development, economic planning and development. The study can assist in regional and national economic efforts by emphasizing the role of cooperatives in achieving sustainable development. May I water? So the application of the sorry, sir, I'm not able to get it. Here is the conclusion that the research demonstrates the cooperatives like SEWA Bank serve as the enablers of grassroots empowerment. financial inclusion and social development. Sorry.
It's all right, Deepshika, just slide down the slides. Thank you so much, Deepshika. I would now request our.
Extremely sorry for the disturbance,
It's all right.
for the inconvenience.
Almost when completion, you know, right? There is no doubt that SEWA is doing an yeoman service, and the banking activities are also to the downtrodden. Everyone has to appreciate on that. So, a few things just I would like to say. One is about empowering grassroots. That means one is the cooperative bank, what is the service it is rendering to the rural people. And second one is that now you are saying empowerment, and in some places you have mentioned that it's impact also. So whether you have studied the impact, first question, if you have studied the impact, how many people you contacted and what is the result, what is the variables you came out with, right? That is one question I have. Second one, whether it is registered under RBI, I mean licensed, right? Whether it is under the State Act or Multi-State Cooperative Societies Act, right? That you just clarify. And next one is findings, suggestions, and the conclusion. There has to be some coherence, you know. What you have actually found out, what is the finding, real findings based on your field study, and then the suggestions must be based on that, right? And another important thing, you have given the table also. There are, when you are giving the table, the interpretation must be clear. One is you say the total deposit is, I mean, just comparing the last year only, 2022-23, it's around 344 crores. And the total working capital, when you add share capital and deposit, you don't get the total working capital. So remaining is whether it is a reserve fund or borrowing. That you have to clarify, one thing. Second one is that when you have total working capital of 461 crores, your loan is only 203 crores. So what happened to the remaining amount? Whether they have invested, what is the return it is giving? Right? Second point. And then they say your profit is almost, it is 4% of the total working capital, 4 to 5% of the total working capital, you know. So in that case, what is the interest they charge, right? For the amount which they borrow and also to the deposit. What do you spread normally you have? What I'm saying is that margin. Spread normally what you have, I mean, what the bank is receiving, right? And another important thing is that overdue, NPA, non-performing assets. What is the percentage of non-performing assets in the case of the SEWA Bank? No, those things, because you have taken up a case study, right? Almost only one bank. In that case, you have to be more clear on that area, right? Please. That's it.
Sir, it's registered under the Gujarat State Cooperative Societies Act 1961, the bank. And when I did the field study, I have covered Ahmedabad and Gandhinagar districts, wherein I have discussed with more than 200 members of the SEWA Bank. And
Right. When you are presenting it, you know, even in the paper also it is not mentioned. You have to mention that you have contacted 200 people and you went to 2 banks, and what are all the in which you asked questions, what was the result, right?
Okay.
So that clarity must be there.
Then, sir, we are providing training to these females also who are working in the SEWA Bank. So we are constantly in touch with them, and all the different kind of products which are introduced by them. We are aware about the same, and through the training and education programs, we have seen that there is a positive impact in the field.
Only. What is the proof you have?
Sir, I have
that data you must give. No, I am just giving you because it is not found in your paper. You must note it down. When you say that positive, it's like a sweeping statement. Anybody can say that no, their economic status has improved and social status has improved. But what is the proof and where is the proof?
Sir, so I did the question as
substantiated with the data, right? That is one thing you have, right?
Sir, actually, I prepared one questionnaire for them, and I have taken their reviews. I have taken their answers from that. So I need to mention in the research.
Found in the paper.
Sure, sir. So I will add this.
Should have been attached, but
Data.
Okay, okay. Sure, sir. So I will attach all of
Right.
them.
And I think key financial indicators, few questions I just.
Yeah, yeah. Sir, as far as those data are concerned, when I discussed with the main head of SEWA Bank, I met Bhumika Joshi madam. So she told me that all the data are mentioned in our website. So I have taken from that whatever those data are. I have collected from their website. So as far as the gaps which you are asking me, I'm clearly not aware about what they have done and why there are differences in the working capital and in the profit margin and the difference. Yeah, definitely. But sir, I will make a point that I will ask them about all these things. Yeah. Sure, sure, sir.
Thank you so much, sir. Thank you so much, Dipchika. Next in line, we have B. Krupashri, and she'll be presenting on topic PACS as multi-service centers with an emphasis on health care services. Welcome, Krupa. All the very best.
Good. Okay. It's multi-service center with an emphasis on healthcare services. So, action. Action by nearly 1.2 billion significant rural health
Challenges including poor infrastructure, high costs, and limited awareness. PACs, originally financial cooperators, they have the potential to support essential healthcare services. So, expanding PACs into various multi service activities, particularly in rural areas, will increase the health access, affordability, and awareness. And this can also be linked to SDG 3, which is health and well being for all. And moving on to objectives, to analyze the evolution of primary agricultural cooperative credit societies as multi service centers, to explore integrating healthcare services into PACs to address the rural health issues, and to assess the pros and cons of sustainability and impact of healthcare services provided by the PACs on rural health. And my research questions are: how have the PACs evolved as multi service centers? What are the key challenges and opportunities in integrating the health services into PACs? What are the economic impacts of PACs based on health services of rural communities? What financial and operational models of sustainability of healthcare services can be implemented? And what are the advantages, limitations of delivering healthcare service in rural areas? How does integrating health into sustainable development goal help for the working of the PAC? And what role do community participation and governance play in success of PACs-led health initiative activities? So going to the review of literature, uh, there are actually very few studies on the details collected in the cooperative medical shops, and the PACs have started running the medical shops recently, and review of literature shows that the customer satisfaction in the cooperative medical shops is satisfactory, but still there are very few literatures on this field.
So moving on to the statement of my problem. The rural communities in India, especially in Tamil Nadu, face many difficulties in accessing good health care. The poor infrastructure, the high medical costs, and low awareness about the health led to the poor health conditions. PACS mainly offers financial support to people, but they have the potential to provide health care, and their strong presence, trust, and cooperative structure make them offering affordable medical care and preventive health services, and they can run many awareness programs also. So this study explores how PACS can expand its services to improve the healthcare access and enhance the rural well-being. And it also examines the management sustainability challenges in turning PACS into multi-service centers aligned with SDG 3. So moving on to the research methodology, the study employed descriptive research design based on the secondary data. The data was collected from the Adikombo PACS, which is a PACS society of Dindakal, Tamil Nadu, and Abhirami Consumer Cooperative Wholesale Stores, which is a wholesale stores which comes in Dindakal district, and Dindakal Agricultural Cooperative Marketing Society. And the secondary sources were also taken from the National Cooperative Database, government reports, academic journals, newspaper articles, and the information has been carefully analyzed and interpreted to comprehensively understand the cooperative medical service strengths, challenges, and contributions. So moving on to the health setup or overview of India, there is a strong demand for the healthcare sector in India. The Indian healthcare market, which is valued at US dollar billion 110 in 2016, and now the projected data is dollar 368 billion by 2025. There's a huge rise up in the demand for health, and the demand for Indian healthcare professionals is expected to double nationally and globally by 2030 due to the shortage of healthcare workers in India. And talking about the doctor population ratio and nurse population ratio, it's 1.7 nurses per 1,000 people, and the doctor to patient ratio is 1:1, and it is 500 nationwide. And this is a scenario throughout the India, and this was taken from IBEF survey of 2025. And then moving on to the opportunities, India's healthcare spending rose to 1.9% of GDP, and it rose from 1.6%, and it has reached nearly 2.5% in 2025. And there is demand for the manpower also. So the manpower demand has nearly risen up to 1.308 million in 2022. So all this highlights that there's a huge demand for healthcare sector in India, in particular after this COVID crisis. So now this is the same details I've given it in the tabulation. This was the IBEF report of 2025, and the healthcare industry's growth in 2023 was nearly 372 billion. And these are a few details which I have projected earlier. Moving on to the next slide. Overview of health in Tamil Nadu. So Tamil Nadu has a total population of about 81.5 million, and it ranks 7th of the most populous states in India. And more than 50% of the population resides in rural areas of Tamil Nadu, and they reside in the villages. So the most significant indicators are the maternal mortality rate, which has dropped by 2 to 4 points. And in 2023 to 24, there has been a notable drop to 7 points, and we can say that from 52.27% to 45.6, and this was the report taken from the Health Mission Survey report of 2023 and 24. So moving on to the history of medical services in India, Tamil Nadu specifically, this concept of PACS running medical shops is not real. The medical shops have been run by the consumer cooperative wholesale stores since early ages, and it is 3-tier structure. And at the apex level, we have Tamil Nadu Consumer Cooperative Federation, which is at the apex level, and at the center comes the consumer cooperative wholesale stores,
And at the bottom level, it comes the primary cooperative societies at the village level, at the grassroots level. And the consumer cooperatives in Tamil Nadu operate a three-tier system. And as of data given by the TN policy note of 2023-24 from Department of Cooperation, there are nearly 40 district consumer cooperative stores and 363 cooperative stores which are operating medical shops. So this is the details of total medical sales. Nearly 380 cooperative medical shops are being run by the consumer cooperative stores, and the turnover in February 2023 was rupees 156.61 crores. And in the year 2021, 70 new medical shops was inaugurated by the Honorable Chief Minister, and those sales in those 70 shops alone amounted to 13.64 crore by February 2023. This shows that there is a huge demand and a good quality of medicines, and people prefer buying medicines in cooperative medical shops. So this is a detail of consumer cooperative wholesale stores of network in Tamil Nadu. The consumer cooperative wholesale stores offers variety of services, and out of the variety of services offered, the PDS is the most highest service, public distribution system, and the next highest service is the cooperative medical shops. 133 medical shops are run by the consumer cooperative stores at the district level. And this is in specific the sales performance of the consumer wholesale cooperative medical shop in Dindigul district. The sales performance have been given for the year 2018 to 2025, and the chart shows that the sales have gradually increased from the year 2018 to 2019, and there has been a sharp rise in the sales. So the sales has increased again to 45 lakhs nearly in 2024 to 25, and there is a positive trend in the sales. And next we are moving on to Amma Marundaham, which is another initiative of our cooperative society, which is run by the Cooperative Marketing Society. This is a comparison of sales between the cooperative medical shops and the Amma Marundaham, and the details are given for the year 2018 till 2025. So the cooperative medical shops and Amma Marundaham, both the sales remain almost the same. However, in the last period of 2022-23, the medical shops saw a significant increase in sales, whereas Amma Marundaham has faced a slight decline in the previous years. So this is the sales performance of Amma Marundaham in the district of Dindigul for the year 2021 and 25. So it has seen a steady rise in the sales and increase in demand from 5.81 lakhs in 2021 to nearly 9.10 lakhs in 2022-23. There is a slight decline in the sales, but overall, despite the decline, the long-term sales remains positive. So this is a comparison between cooperative medicals and Amma Marundaham of Dindigul. So we can obviously see that Dindigul Cooperative Marketing Society has grown steadily, but the sales has declined in 2024-25, whereas the Consumer Wholesale Cooperative Society has, in spite of facing fluctuations, it has maintained a peak sales in 2024 to 25. So moving on to PACS, Primary Agricultural Cooperative Societies. This was the earlier history of medical, and how we all know about PACS. PACS is a blueprint of the entire cooperative department, we can say. So the PACS is at the village level and the grassroots level credit association institution, and it provides not only the credit but also various non-agricultural activities and non-credit activities are also conducted through PACS. And this is the operation three-tier structure. At the apex level, we have the cooperative bank at the Tamil Nadu, and then comes the district level, and the primary agricultural cooperative credit societies, which is at the village level, taluk level, which is at the grassroots level. And there are nearly 4,453 packs operating in Tamil Nadu. And these cover nearly 12,525 village panchayats. So this is the main initiative of the government which has taken in recent years. So this is the status of Jan Aishudhi Kendras. Jan Aishudhi Kendras are nearly 10,500 are being operated. And the most important thing is the Union Minister Dr. Manish Mandavia has announced that 2,300 packs have received approval to open Jan Ayushudhi Kendras, and nearly 500 packs have been in operation. And by the year September 30, 2024, nearly 13,822 Jan Ayushudhi Kendras across the country coming under the Pradhan Mantri Bharat Jan Ayushudhi Prayojana scheme, and they have achieved a sales of nearly 200 crores. So from the details collected from the ministry's website, Union Minister Amit Shah has informed that 4,470 packs from 33 states and union territories have applied to open the Jan Ayushudhi Kendras. And the pie chart shows the distribution of applications from the states which have given the highest number of applications. Uttar Pradesh has the highest number of applications, 880, and followed by Maharashtra 430 and Madhya Pradesh 313. And now, as of now, the last detail collected, the November 30, 2024, there are nearly 687 Kendras run by the packs. So this is a recent initiative taken by the government of Tamil Nadu, Mudalvar Marundaham. There are 1,000 Mudalvar Marundaham operating across 38 regions of Tamil Nadu, and out of the total 1,000, nearly 538 Mudalvar Marundahams are run by PACS societies. And the Tamil Nadu government has opened 1,000 generic medical shops. It was opened on Feb 24, 2025, as per the order, government order of 136. And also the Food Safety Administration Department has also, yeah. So this is the Mudalvar Marundaham, and nearly, just one fine example is, a pill costing rupees 70 in private pharmacy is available for just rupees 11 at these outlets. And the patients who can spend 3,000 per month on the medicines for chronic illness like diabetes, hypertension, will be spending just 1,000 on these Marundahams. This is a good initiative of the PACS, where the PACS run the medical shops. And these are all the key findings. There are 538 PACS run medical shops, which is a recent initiative. And as of November 2024, there are 685 Jan Ayushudhi Kendras run by the PACS. And moving on to the comparative sales of Cooperative Society and Amma Marundaham. Cooperative Consumer Wholesale Cooperative Society medical shops has been running and the progress has been steady, whereas the Amma Marundaham sales has been a slight decline in the sales. So the main suggestions are converting PACS into multi-service centers with provision for healthcare can improve the village healthcare status. Collaboration with the primary health centers can improve to serve more people and reduce the pressure on government hospitals. The PACS are running Jan Ayushudhi Kendras to sell low-cost generic medicines, and they can also improve multiple services like healthcare, financial support, and farm assistance. Working with government programs, NGOs, and public groups can further strengthen the rural care at the with PACS, and expanding health services through PACS can create jobs for health workers, pharmacists, staff in the state, and it acts as a source of empowerment also.
Thank you so much, Rupa.
Yes. Yeah, and this is the final thing where the PACS can integrate multiple services like elderly care, procurement of medicines, child care, and it can offer jobs, and it can integrate with PHC, and there can be a doctor functioning in every PACS, which is running medical shop, which can provide more affordable services. So to conclude with, the recent initiatives taken by the cooperation that backs running Jan Aishuddhi Kendra, Mudalvar Marundaham, and the long back initiatives of cooperation department running cooperative medicals and Amma Marundaham have all been helping public a lot. Thank you.
Thank you so much, Kripa. I would now request the expert jury to please ask their queries.
So, Kripa, this is a second presentation, particularly on the healthcare aspects. And one thing is that basically what led to this research work, because you say that the health services provided by the state is very good. In that case, what is the necessity for the cooperatives to involve in this health aspect, right? This is one thing. Second one, then there is a thing whether the cooperative medical, Amma medical, and the Mardam are different. Because one table says that the sale of medicines in cooperative medicals and Amma Mardam, we have made a comparison. This is one thing. Second, on the other table, you say that the medical cooperative marketing society is having an Amma Mardam and its sales system, whether it is all same or different, right? And suggestions, another thing, you suggested that that is implemented very recently, isn't it?
Yes.
So we cannot study the impact or anything about that. So when the government has come out with 1,000 shops are going to be opened, how many have been opened under the cooperative fold, whether it has been given to the private people also. So that data or details can also be given to you. Yeah, please.
From
Yes,
your
sir.
study, what study aspects do you think that can be replicated elsewhere? And the second question is that your study is primarily based on the secondary sources. Do you think that if you could have, taken the primary sources, for example, focus group interviews, surveys, and all those things, then your study could have become far more better, more, So, and these are the two questions like that.
Yes, sir. So, there are several medical shops running at the state and at the entire country, but these medical shops which are run by the cooperatives are not for the profit motto. So they are provide the medicines at more affordable rate, which is much beneficial for the people. And also comparing the healthcare services which the cooperative offers throughout India, there are 4 states where the cooperative unit is running with a hospital setup. But when it comes to the case of Tamil Nadu, the medical shops are run successfully by the cooperatives. So I have chosen the cooperative medical shops performance in Tamil Nadu and how these initiatives are helping people and how it will be beneficial for them. And talking about the Mudalvar Marundaham and the cooperative medical shops, both these are different. The cooperative medicals are run by the cooperative consumer cooperative wholesale societies, and Amma Marundaham was started in 2015, which is also run by cooperation, but just the name has been different because it was a honorary for the CM Dr. Jayalalitha, and it is run by the marketing societies of our cooperation department, and both are entirely different. And comparing the sales of consumer cooperative stores and Amma Marundaham is the sales performance at all the medical shops operating at the level of Tamil Nadu from the year 2018 to 2023. And another place where I have mentioned the sales of Amma Marundaham is the sales of Dindigul district, where Amma Marundaham is functioning under the marketing society. Yes, sir. I agree that if I could have gone for a focus study or I could have collected the customers' satisfaction or a questionnaire and the primary data, if I would have done, it would have been much more effective. And two things which I could learn is that generally in Tamil Nadu, the healthcare services need a lot of expansion. So this is the only sector in medicals where the healthcare services are being expanding. So when we throw more light on that, and I saw there were very few research in this topic and very limited. So I thought I can dig in everything and bring out the aspects and bring some applications. So it may turn out to be a successful model because this sector is the only sector where the cooperatives extend healthcare activities in Tamil Nadu. Thank you, sir.
Any other questions? Thank you so much, Rupa.
Thank you.
Now we'll be having Dr. Sanoop MS, and we'll be talking about an assessment of food security through massive grain storage in India, the role of cooperatives. Welcome, Sanoop, and all the very best. Participants, those whose PPTs have not been submitted to this fellow, please give it to Manish. Every one of you have submitted your presentation. Is Pradyuman here? Pradyuman Hale? You didn't tell me, you didn't mark your attendance. Did you give your presentation? Please give it to Manish. That is what I am saying, no? You have sent it to him? Okay. So you will be presenting on 12th number. Okay. Then Rachita is here. Okay. Okay, Sunu. Over to you.
Thank you, madam. Good morning, everyone. Distinguished panelists of the session, respected Professor Ripicha sir, Sanjay Kumar Verma sir, Dr. Srija Sinha, and other dignitaries. Very good morning to one and all. I am Dr. Sanu Benas, Assistant Professor, Department of Economics, University of Calicut, Dr. John Mathai Center, Thrissur, Kerala. My topic today's presentation is an assessment of food security through massive grain storage in India, the role of cooperatives. So I'm starting my presentation. Security envisaged needs to ensure food for all in the plane of sustainable development. Nowadays, food security is a common problem because of mainly two reasons. One is physical access to food, and second one is economic access to food. FAO, UN Food and Agriculture Organization, defines food security as the condition in which all people at all time have physical, social, and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences for an active and healthy life. So there are four pillars of food security, that is availability, accessibility, affordability, and stability. The factors such as growing population, climate change, rising food prices, land use pattern, etc., have a significant impact on food security. The availability component in food security deals with the production of food items, and the accessibility of food deals with the consumption side. Affordability deals with the purchasing power of the individuals. Access to food is determined by entitlements. So India is the most populated country in the world, and in terms of land coverage, our country holds the position of 7th in the world. India is the second largest producer of wheat and rice as per the estimates for 2022-23. Total food grain production is estimated as 296.87 lakh tons. It indicates that India's position in terms of food production is much better. However, as per the FAO data, the total food production in India is 311 million metric tons, and the total storage capacity is only 145 million metric tons. That means there is a shortage of 166 million metric ton of storage. This leads to wastage of food grains, and it creates hoardings in the food supply. Due to the inadequate storage facilities of food grains, preventing the country from achieving food self-sufficiency. We have the zero hunger index goal. In this context, the significance of cooperatives are very much potent force for economic growth, and it addresses the lack of agriculture storage infrastructure by establishing governance at the primary agricultural credit societies in order to address the shortage of food production. So I am concentrating on the literature review. So mainly, food security has been a critical concern for India due to its rapidly growing population, fluctuating agricultural productivity, and significant post-harvest losses. The literature highlights the multi-dimensional challenges and opportunities associated with the food grain production, storage, and distribution, as well as the pivotal role of cooperative institutions in addressing these issues. So I have incorporated some of the reviews, I have gone through it. And coming to the research, based on my review of literature, I have formulated the research question. There are two research questions I have. What are the key challenges in terms of the storage facilities of the produced grains for ensuring food security in India? Second question is, how do the massive grain storage facilities managed by the cooperatives affect the income of the farmers and rural livelihood and ensure the food security in India? Based on these two research questions, I have formulated two objectives. First objective is to examine the present food security situation in India in terms of production and storage. And the second objective is to assess the massive grain storage facilities managed by the cooperatives contribute to ensuring food security in India. To satisfy these objectives, I have some methodology. I am basically my studies purely secondary data sources, and my data sources are annual reports of the Department of Agriculture and Farmers Welfare, agriculture statistics at a glance, Ministry of Agriculture and Farmers Welfare, Warehouse Development Corporation, Development Regulatory Authority, Department of Food and Public Distribution, National Food Security Portal, Central Warehousing Corporation, Ministry of Consumer Affairs, Food and Public Distribution, annual reports of FCI, Indian Cooperative Movement and Statistical Profile, and annual reports of Ministry of Cooperation. So my data I'm taking the data from the period to 2014 to 2024. So my presentation is based on the two things, based on the first objective and the second objective. In this section, I am examining the present food security situation in India in terms of the production and storage in the first part. And the second part, that is the massive grain storage facilities managed by the cooperatives contribute to ensuring food security in India. So I'm going to the first slide. That means, the first diagram. This diagram shows the food grain production trends in India from 2014 to 15 to 2023-24. So India's agricultural sector has seen consistent growth in food grain production over the past decade. See the first line, that is the green line. It indicates that the food grain production increased from 252.2 million tons in 2014-15 to 332.29 million tons in 2023-24. This means 31.85% growth over the 10 years. That is a remarkable achievement in the food security. That is highest ever production recorded in 2023-24. And the rice and wheat production increased at the rate of 30.9%. And rice, wheat, and cow cereal pulses are in the coming in the below lines. And there is a slight variation in the production of pulses and cow cereals over the years. Coming to the next slide, that is the gross area of food grains. That is the gross area of food grains has remained relatively stable and fluctuating between 124.3 million tons and to 132.2 million tons in the year 2022-23. That means the area under rice cultivation increased from 2014-15 to 2023-24 from 44.1 million tons to 47.6 million tons. This trend shows there is an increase in the rice acreage and there is a slight variation in the area of wheat, pulse, and cold cereals over the years. So this is a comparison between the food grain production and area in India. See, while look at the picture, we've seen that India's agriculture has seen a consistent growth in the food grain production and area of allocation over the past decades. That means there is a 31.85% of growth in 10 years. That is a remarkable achievement in food security. And coming to the next slide, that means the total the operational storage capacity of Central Warehousing Corporation. I'm taking the data from 2016-7 to 2023-24. The total capacity increased from 99.65 lakh metric ton in 2016-17 to 109.92 lakh metric ton in 2023-24. That is, there is a growth of 10.2% over the years. The peak capacity of 122.69 lakh metric ton in 2020-21, reflecting high demand during COVID-19 pandemic. On-the capacity and hired capacity, on-the capacity increased at the rate of 11.5% and hired capacity percentage increased at 96% in 2023-24. So this is the position of stock position of wheat and rice and the stocking norms. see the below line, that is a red line, it indicates the stocking norms as seen in the red line in the picture. It is seen that the rice stock consistently above the required norms, ensuring food security. And there is a fluctuation in the wheat stock levels over the years from 2017 to 2024. And this is the total stock food grains in the central pool. It is quite simple to understand that there is a middle bar that is a north zone. Here, that is a north zone has the highest total stock of 180.76 lakh metric ton, mainly contributed by Punjab. South and west zones have significant amount of rice stock, while Madhya Pradesh contributes the most to wheat stock. Northeast zone has the least stock compared to other regions. And the total storage capacity in different sector. The storage capacity in different sector, that means the corporate sector contributes the storage capacity of 15%, and the state warehousing corporation and state agencies of 26%, and private sector contributes the 46% of the storage capacity. And the growth in storage in the central warehousing corporation, it is the storage capacity is increased from 99.78 lakh metric ton in 2016-17 to 127.59 lakh metric ton in 2023-24. And the state-wise storage capacity under cooperative sector, I'm not putting all the states, I'm putting the major states. That means cooperative sector from Punjab, Uttar Pradesh, Maharashtra, Karnataka, Tamil Nadu. And in the bifurcation, there is a National Cooperative Development Corporation, NCDC, and Primary Agriculture Cooperative Societies, PACS, and the National Agricultural Cooperative Marketing Federation, NAFED. As a total, NCDC has a storage capacity of 16.51 million metric tons, and PACS has a capacity of 6.26 million metric tons, and NAFED is below that level. And coming to the state-wise storage capacity under cooperative sector, the regional disparities indicate that states like Maharashtra, Uttar Pradesh, Punjab, and Karnataka dominates NCDC storage capacity. For PACS, Karnataka, Andhra Pradesh, and Tamil Nadu have significant contribution. NAFED storage is concentrated in Rajasthan, Maharashtra, and Tamil Nadu. Northern states is having the highest agriculture storage capacity with followed by center states, southern states, and western states, eastern states, and northeastern states and union territories having 1% of each. And cooperatives has their storage capacity majorly in south state with the 30% of the storage capacity, followed by central India, North India, Western India, Eastern India, Northeastern India. Currently, National Cooperative Development Council has sanctioned the storage capacity of 16.51 million metric tons under the scheme of Integrated Scheme for Agriculture Cooperatives for the cooperatives. National Agriculture Cooperative Marketing Federation of India has a storage capacity of 0.06 million metric tons for their storage of godowns, which are manufactured by the cooperatives. Also, NAFED has warehouse near seaports of Chennai and Mumbai for export of goods. And PACS of all over India have 6.26 million metric tons of storage capacity at present. So based on this, my findings are the cooperatives significantly contribute to India's food grain storage with over 22.5 million metric tons of capacity. Primary agriculture credit societies alone contribute to around 6.26 million metric tons. And states like Maharashtra, Punjab, and UP have the highest cooperative storage. And the National Agriculture Cooperative Marketing Federation plays a key role in procurement and storage with the total storage capacity of metric ton across the 59,039 metric ton across India. It supports the government's price stabilization and procurement programs. And PSCS manages the largest share of cooperative sector storage, benefiting small farmers by providing nearby storage solutions. In states like Karnataka and Tamil Nadu, PSCS storage is critical for grain security at the village level. Cooperative storage reduces post-harvest losses and ensures stable food supply through the periods. Modernization and financial support can enhance corporate efficiency and contribute to long-term food security. So, I conclude. So, India's food security framework stands with the growing food grain production, close against inadequate storage infrastructure. Despite being second largest producer of wheat and rice globally, the nation faces challenges of storage deficits, food grain wastage, and inefficient distribution. This storage gap, currently estimated at over 157 million metric ton, hinders India's ability to fully realize food self-sufficiency. Cooperatives Particularly, the efforts of PACS have emerged as a pivotal in bridging rural storage gap. Their grassroots presence enables equitable access to storage for small and marginal farmers, improves rural livelihoods, and reduces post-harvest losses. However, the cooperative sector contribution, while significant, is still underutilized compared to the private sector, which dominates with nearly half of the total storage capacity. The Government of India's recent initiative to launch the world's largest grain storage plan in the cooperative sector is a transformative step. This underscores the importance of leveraging cooperative to strengthen food security, ensure fair pricing for farmers, and minimize reliance on private players for storage infrastructure. Cooperatives are uniquely positioned to address the dual challenges of inadequate storage and equitable distribution. By increasing their storage capacities, they can directly contribute to reducing food grain wastage and ensuring that surplus production reaches undeserved areas efficiently. Strengthening cooperatives will also foster rural development and empower farmers, enabling them to store produce safely and avoid distress sales. So these are the references I have been used to prepare the paper. Thank you.
Thank you so much, Sunu. I will now request our expert panel to please ask your queries.
Yeah, Dr. Sonu, we have come up with very good database, and particularly on the food grain production and the storage data is good. Very good work you have done on that. And certain thing is that the topic is that role of cooperatives. And one is the government is coming out with, ministry has come up with one of the largest storage grain storage scheme. One of the appreciable thing. But the data which you have presented cannot be, I mean, for the entire country, because particularly in South, the storage capacity is more than the requirement. And one table which probably there is a difference. Table number 7, you say that NCDC godowns, tax godowns, and NAFED godowns. There is no NCDC godown. NCDC is supporting the cooperatives for construction of godowns only. So it doesn't have on its own storage, godowns, right? And NAFED probably they may have, but through what do you say, agricultural cooperative marketing societies, they may have. So this data you have to just go through it once again. Because there are a number of schemes for construction of cooperatives. Now the government has come out with new scheme. One is NCDC through ICDP scheme, and also that is Common Bandharan scheme. So that, through that scheme, they are giving support to the cooperative for construction, not only for primary agricultural cooperative bank, it is for the other cooperatives also, other types of cooperatives. And Nadu is also having a scheme under RIDF, Rural Infrastructure Development Scheme. They are also providing support to this, right? So there are different schemes for construction of cooperatives under the for the cooperatives. But that data, you will have to just come out with what is the utilization. You have given the data for the CWC, Central Warehousing Corporation, but not for the cooperatives. Because most of my experience is that, particularly in South, where the godowns are in tax, it is underutilized. Because of the scheme, the societies have constructed 2-3 godowns, but even one godown is not utilized by the cooperatives. So there are situations, but in some other places, we don't have even godown, there is a requirement. That is why the government has come out with that scheme, right? So that you have to look into it. And that storage data, that has to be given. I think that while making the presentation PowerPoint, don't copy from Word and then paste it. Okay, that's one advice for everyone.
Thank you. That was a very, very, analytical study. Though it's a research paper, research conference, but I think, analysis is also a very, very important part of the research, which you have taken from various reports and you have analyzed it. So you haven't gone through the, primary sources, but then I think, theoretical way, analysis while it's a very good paper. But as far as literature review is concerned, I just went through that portion. It doesn't seem, literature review, you haven't elaborated much like that. Which are the literature which you have used, something like that. You haven't made references to all these, books like that. So maybe you could have, you could have analyzed the trends of the major literary trends over a period of 5-10 years like that. So, and another important thing is that now, you could have given a comparative perspective of the warehouses, run by WDRA, Warehouse Development Regulatory Authority, in packs, and some other, those who are not related to, WDRA. So some comparative perspective you could have given in that paper. Thank you.
Thank you
So,
so much.
yeah, madam, you wanted to say? Yeah. So, based on the panelist observations, teachers have said that growth scholar scheme, there is an NCUI and the NAFED data. So, and then there are also allowed schemes and different schemes I want to incorporate. And some of the schemes that is very right because there is a in other states now some of the storage facilities are underutilized, and I want to incorporate this part. And in the Sanjay Kumar said that there is which is based purely on based on the secondary data sources, and based on that I'm in the comparative study between the different WBR and other experts also. And based on due to the time shortage, I'm skipping the literature review. I have already gone through all the literature, and I based on the literature, I have coming to the research question. So due to the shortage of the time, I have skipped the literature part. So, and I wanted to incorporate in future based on the primary data also, I want to incorporate the theoretical part and the comparison and more study concentrating on the primary data sources. And also the grain storage plan has already introduced by Government of India. In the pilot surveys, 11 states is going on. So based on that, I want to incorporate in the further studies in this pattern.
Thank you so much, Anup.
Thank you. Thank you.
Next, we have Mohammed Shafi P, and he'll be presenting on topic Youth Cooperative Communication Strategy, Media Production, Brand Building in Cooperative Sector, a cooperative society with a difference, why Coop Limited. So we welcome Mohammed Shafi, and I wish you all the very best for your presentation. Mohammed Shafi P. Yeah.
I am Muhammad Shafi from Kerala. I am to say Youth Cooperative Society, ICOOPS, a real Kerala Youth Branch Media Cooperative Society with the support of Government of Kerala. Youth Cooperatives, Communication Strategy, Media Production, Brand Building in Cooperative Sector. Okay. First thing, why is not anyone talking or discussing about the media cooperatives? At that time, I am introducing youth cooperative in Asia first time. What is ICOOPS? ICOOPS is Artist Welfare Youth Cooperative Society. Asia's first youth brand media production cooperative society focused on decentralizing media content creation and empowering grassroots voices, aimed at addressing underrepresentation of local artists, journalists, and activists in mainstream media. Mission and vision. Founded in Kerala to amplify contributions from Kerala's cooperative sector, emphasizing the vital role of media as the fourth pillar of democracy. So key features: operates as part of Kerala's 100-day action plan, first cooperative society in India to use drones for media production. Equipment for live broadcasting, satellite models, DSNG motorsports, and LED wall TV directors. Our services: PR media production, content creation, brand building for youth cooperatives and government institutions. Over 33 national and regional media outlets covered ICOOPS. Pioneering new initiatives such as Cooperatives Media College offering courses in journalism and media production. So office is based on Kerala, Kollam, Punalur. The office is designed with a recycled materials. Creative workspace using furniture made from vehicle parts. Cooperative structure. Total 52 shareholders aged under 18 to 45. Board of Directors is 9. Focus on financial and operational economy. Community impact. Provides competitive salaries and job opportunities, especially in rural areas. Helps reduce dependency on traditional, expensive media production methods. Supports the artistic community during times of crisis. Example, COVID-19 pandemic. The basic formula is BCom cooperation, journalism and mass communication, PR and advertisement, library science. Methodology. Quantitative research is 3 case study approach: interviews, focus groups, document analysis. Second, quantitative research, employment and economic impact. Surveys, employment data, client feedback. Third one is observational research, subpoint office design, media production. Fourth one is content analysis, media coverage and public perception, media representation, public perception. Comparative analysis, ICOOPS versus traditional media and private sector media. Our future projection and strategies planning: media art library, cooperative history museum, Coop on wheels, traveling office OB1, yearly media programs and anniversary, online channel and new media. Media cooperative school and institution, digital print and magazine, movie theater. Literature review. Addressing gaps in media representation. Innovating model of media production and cooperative structure. Government collaborate and recognition. Community impact and employment generation. Democratization of news. Amplifying the cooperative sector. Scalability, strategy, and market potential. There are short term, medium term, and long term. Short term, media production and PR. Medium term, short film and documentary fest, online Coop news, digital and print, magazine news, web media. Long term, AI, content generation. Cooperative values and principles. iCoop's shareholders are our media labor in different working categories. It is working under a bylaw that addresses financial autonomy, funds, share capital, nomination, debts of members, deposits, accounts of books and records. Operations autonomy. Sorry. Financial autonomy, funds, share capital, nomination, debts of members, deposits, accounts of books and records. Operations autonomy, objectives, day-to-day operations, removal of membership, common meeting, election, common meeting, annual meeting, director board meeting. Customer segmentation, iCoops mainly focuses on cooperative sector media production, cooperative societies, cooperative institutions, cooperative unions, cooperative banks, cooperative federations, central and state government departments. Okay. Results and discussion. Empowering local artists, journalists, and activists. Economic impact and employment generation. Community empowerment and social responsibility. Innovative business model. Sustainability and creativity. Diverse media services and technological innovation. Media recognition and national impact. Cost structure and revenue streams. Existing revenue streams are media production contracts, advertising sales, event fees, graphic designing, and PR services. Future revenue streams, leasing and rent, conducting expos, media production school. Cost structure, fixed cost and variable cost. Final thought, iGroups represent a unique and promising innovation in the cooperative sector, especially in media production. It demonstrates the potential of cooperatives to disrupt traditional industries, offering more ethical, inclusive, and sustainable alternatives to commercial models. As it continues to grow, iCoops can serve as a model for the sectors, providing a blueprint for how cooperatives can function effectively within cooperative industry. The cooperatives focus on youth, empowerment, and sustainability have laid the foundation for more inclusive, diverse, and community-driven media landscape in Kerala and beyond. Yeah.
Thank you so much. Good.
Shafi, the topic of your research was very good. But you have set up this ICOPS, Kerala Youth Brand Media Cooperative Society, and it is the first cooperative society. But then you could have done a more detailed research in the sense that you have highlighted only what the functions which you are doing, what are the programs which you are doing, and moreover literature review is totally lacking. The objectives of this, research paper is not very clear like that. You haven't, what are the research objectives? For example, you could have reviewed the communication trends of the cooperative sector in India, and you could have found the gaps, and then you could have mentioned that, this youth media cooperative is, fulfilling a big void in this communication. So, firstly, the objectives are not very clear. Literature review is not very clear. References you have just mentioned, uh, about yourself projects and all those things you have mentioned. The references you have not mentioned. So you could have taken a review of the, communication literature in the cooperatives for the last 5, 10 years, and then you could have said that how, based on the literary trend, research gaps, and how this, ICOPS is addressing these needs of media cooperative. And secondly, the action point which you have mentioned is also not very, detailed. It doesn't, and you said that you have taken group discussion, you have focused group interviews, you have also taken like that. But then what is the sample size of the people you have interviewed? That is also not very clear like that. So I think, the topic is very good, but the everything appears to be very, very sketchy and without any, research orientation. So otherwise, I think this is a very, very good, because, we don't find, papers on communications like that. Very few papers on communications, and you have come up with this paper. So that is all.
Okay.
Thank you so much, sir, and thank you so much, Shafi. Next, we have Mohit Dave, and he'll be talking about. Yes.
Safi, just I want to.
Just to answer the question.
So what we can say is that it's a very good innovative society that you have started. That is the only thing we can say. One is neither it is a research paper nor it is a case study that you have come out with, right? But it's an innovative paper, innovative cooperative, we can say. When you say ICOP, it is an artisans cooperative, isn't it?
No. It's artists and media persons, not artisans.
Okay. Then you are saying that become cooperation, library science, all those things you are going to provide, or you are providing already? Your college you have set up.
All your setup.
You have set up already.
No. Futurely.
So these are all future. When it was started?
2021.
21. Almost 4 years are over. So when you are saying that it is a cooperative society, you have to have the performance in two angles. One is the financial performance. Another one is that what is the service you have provided to the members and also to the public. So both of these things have not.
Are also.
Let me complete, right? So what is the financial performance? How much you got as a share capital? What is the government contribution? How much you have invested on the buildings and also on the infrastructure and for media purpose? Second one is that what is the services you are providing? For the services, what is the impact it has created? Supposing if you have come out with that, at least we can say that it is a research paper. Or otherwise, if you say it is a case study, holistically you have to provide. What you have done is that these are all the services we are providing, general services, and your future plan only, isn't it?
Yes.
Yeah. It should be either a case study with all the details, or it should be a research paper.
The topic is nice. I think you have appreciation for that. But when we talk about the cooperatives, and yesterday we had a very good discussion about the awareness and the information gap. So media is one thing which can play a very important role in connecting with the youth, right? So your work, further work if you do in this area, can focus on the marketing mix, right? The marketing mix, I hope you know the P's, the price, place, product, promotion, especially the promotion part, and how technology can be utilized better to connect further with the youth. So if possible, and you continue your work in this, try and incorporate that. Okay, good wishes.
Thank you so much, ma'am and sir. Presenting next, we have Mohit Dave, and he'll be talking about leveraging digital platform and AI to enhance cooperative operations and sustainable development impact. All the very best, Mohit. Mohit Dave. Is the sixth presenter? Today's sixth presenter. Next, there is a shift. I want to inform the jury. Next, next, Dr. Bhumika Saroha will be speaking in place of R. Sharmila. All the very best, Mohit.
Yeah, good afternoon, everyone. I'm sure the energy can be a bit better with the presentations that we are having, actually with the very different kinds, some very interesting topics being discussed, right from grain storage and agriculture to, of course, media and cooperatives, and of course, women workers in Ahmedabad and several parts of India. I will try in the next maybe about 10 to 15 minutes to give you some brief background of a very recent initiative that I've been working on, and of course, learning from you on the academic perspectives of how this could be put up at the national, state, and global levels to make sure that it gets the attention of the policymakers, influencers, and stakeholders who would be benefited by such a action. Pardon the graphics. I think the graphics have moved a bit, but yes, the whole point is to try and understand what we are doing in a very small pilot project around digital platforms and artificial intelligence. One very interesting thing that Professor Domre also, I think, mentioned in the keynote speech yesterday. So we are trying to utilize technology, utilize digital platforms and AI in trying to formalize the informal economy. And of course, do this through the cooperative business model and basically see how do we enhance cooperative operations and of course, gain the sustainable development impact and contribute to the larger SDGs criteria that we were all discussing. Very quickly, the research question here specifically is how can AI-driven platforms enhance the multi-purpose cooperatives, especially in financial inclusion, governance, and workforce empowerment? So we are specific about the entity that we are talking about, most certainly a multi-purpose cooperative, which will be in the informal economy. We are talking about technology and AI-driven platforms, also on the platform cooperative landscape. And of course, in this very case, in this subject and topic, we were looking at it from the financial inclusion, governance, and workforce empowerment criteria. And the objectives may be about three odd in the entire landscape. One, of course, the role of digital platforms in cooperative operations. How do we analyze that? Second, the exploration of AI applications in governance and market expansion. And third, of course, there is a very specific case within a cooperative. It's an application called Business Gym. So we try and understand, how has this really added to the, livelihoods of the members that it serves. The methodology, again, we have done a very fair qualitative study, engaging in literature reviews, case studies, and some interviews. The literature review, we were able to look at the policy documents, academic journals, and white papers produced by the cooperative and the larger informal economy space by the International Labour Organization, ICA, and several other organizations. The case study, the case is of a 34-year-old NGO based in Ahmedabad in Gujarat, which has promoted a certain cooperative, goes by the name Saath Jan Vikas Multi-Purpose Cooperative. And of course, within it, there is a business gym concept or an application which it develops. And we were also able to undertake interviews and do primary and secondary research by engaging with cooperative members, policymakers, and cooperative leaders in this very cooperative and the larger area. And as far as the analysis is concerned, a very cursory thematic analysis was undertaken to identify the barriers, challenges, and enabling factors for AI adoption in terms of the cooperative. These are some pictures of a very recent primary data collection that we had, where we talked to, again, we'll speak about the cooperative itself, but to give you the larger perspective, it has various area collectives and various occupation collectives. So there are people who are coming from the beauty parlor cooperatives or beautypreneurs, as we call them. There are home-based care workers. There are small credit unions, credit collectives at the very local level. And of course, there are also occupation-based, migrants-based, they are needs-based collectives which are working in the informal economy. So we were talking to some of their members, staff, and even the community leaders to try and understand how do they operate, what ecosystem do they operate in, and what are the issues and challenges and barriers that we are able to address to this cooperative in one way, and of course the technology and AI in particular. Right, so that's the context, and to now maybe deep dive into the background a bit for the next few minutes. As I mentioned, this is the NGO called Saath Charitable Trust in Ahmedabad, which now, after 34 years of its existence, has spread well across 5 states, mostly around Gujarat, Maharashtra, Rajasthan, Uttar Pradesh, and Jharkhand. It works largely in the informal sector. Its whole theory of change, in a way, has been to focus on informal economy. How do we formalize it? There is, as you probably also know, and I've mentioned a bit more details in the full paper, there is about 82% of the Indian economy which is largely still contributing from the informal space. What we see on the street vendors, who we see as beauty parlor, home-based workers, cooks, maids, and others. So we are trying to see how do we formalize this informal economy, giving them the dignity, rights, respect, and livelihoods that they, of course, deserve, and going beyond and giving the various services, marketing, skill sets, and others which would increase their socio-economic status in the society. This is done through a very recently launched multi-purpose cooperative, goes by the name Saath Jan Vikas Multi-Purpose Cooperative, promoted by Saath and Jan Vikas, two very known NGOs, reputed organizations in Gujarat and around the country. And of course, the app that we were discussing, and we will go into the details now, is the Business Gym app. The focus again being, the founders and the community leaders talked about how we maintain our health to make sure that it is in the right form, shape, and spirit to be able to continue in our daily lives. So this app here is more the Business Gym app to make sure that your business, especially of these nano entrepreneurs and micro entrepreneurs who work in these informal economy, how do we ascertain the status of their business health and make sure they are provided the right kind of tools, training, skill sets to enhance these business operations. Again, the concept here is two-pronged. As you can see on your screen, this is the informal economy in a way generally it looks like. Maybe you can say the green ones are the homemades that we have in our urban environments, cities. The pink ones are the street vendors that we see, the hawkers that we see in our cities. So here, what we've done with the pilot in Saath in Ahmedabad, and now in enhancing our approach across cities, is do area-based collectives and occupation-based collectives, and have them all come under the larger umbrella of the multi-purpose cooperative. So that's how we group them based on their occupations. These could be, maybe people who are working under shoe polish, or maybe working for beauty parlors through their homes, or giving childcare, healthcare services, or old age care services. So we're basically trying to organize them, of course, making sure that their needs, their constraints. Some of these are women who have children to take care of, who have their families to take care of, who cannot venture out much, or maybe who cannot travel and commute much in their cities. So area-based collectives for them, and of course the occupation-based collectives to make sure that they all come under the same platform. And you can possibly look at this as an analogy to the Zomatos of the world, to the Ubers of the world, urban companies of the world, or even policy bazaars of the world. These are all aggregators getting the right set of people within their portfolio, and then, of course, enhancing the bargaining power and the socio-economic status of the aggregators whose opinions they voice. So here's the Saath Vikas Multipurpose Cooperative, who we studied a bit more in details. We can see that they are aggregating groups which are formed by individuals who share a common profession, trade, or economic activity within or beyond a certain ward. We are looking at the municipal level to start with. So it could be wards, and then growing and scaling it further. It could be municipalities and sometimes even states later on. But at this stage, we are looking at the ward and the municipality as the primary unit of analysis. And of course, these are gathered together to make sure that they are able to understand better the challenges that they work on, the needs and opportunities associated with their businesses and their occupations. Of course, the app that we will now talk a bit more in details about tries to provide them this platform at both the customer level and then the service provider level to make sure that these entrepreneurs are able to share resources and collectively improve their livelihoods and working conditions. So here's the app, and I'll also request people to maybe scan the QR code and download. It's just at the pilot stage. We don't quite have a very user-friendly interface already, but we are learning and adapting and adopting as we proceed. But we already have at least 2,500 registered members of the 3,500 members of this Saath Jan Vikas multi-purpose cooperative, who are also slowly but surely, we are making sure that we train them and bridge the gap of digital illiteracy. In many cases, it's still there. While sitting in our comfortable, convenient corners, we might think that we are all now very UPI enabled. But sometimes when we go to these urban slums and these informal settlements, we feel that there is still a lack of the access to and the right kind of information and awareness of utilizing this technology also, which remains our key challenge as well as we proceed. So that's what we've identified. We are empowering these micro entrepreneurs, or AKA MEs, and making sure that we are able to train them, network with them, provide them with financial literacy. Of course, this also happens thanks to Saath and Jan Vikas's prior existing models or masses that they have these credit societies running for 25 years. They have already these loan products, financial products, insurance products that we can provide through these ecosystems. And of course, make sure that these urban entrepreneurs are able to work in their, someone's as a plumber, someone's a cobbler, someone's a driver. So they are able to get on these and be able to get these services and access these services freely and within their organization. Some of these, based on our research and discussions and understandings, we feel a lot of it, the success so far has to do with these one-on-one trainings and mentorings that are happening with these members and these informal economy workers who we are trying to identify. Of course, make sure that they are having that self-identity and business identity. Some of these sometimes, don't even have a ration card or Aadhaar card or a PAN card or something of that sort. So trying to make sure that we get them these documents, we get them this identity of sorts, and then, of course, in whatever way possible, based on their needs, aspirations, and previous work, make them aware about the markets that they can access and communicate better to these markets. Financial literacy trainings and plannings, and of course, technical skills are being provided through this app in particular, and of course, through the existing model and the infrastructure, the soft infrastructure that we have as well within the cooperative. The process is fairly clear. It goes on from first encountering, basically, as we mentioned, establishing the profile, who these persons are, where do they stay, which wards, what is their identity, making sure that we orient them and introduce them to the app. There are specific scoring criteria which are very AI enabled. These are the main areas where artificial intelligence is utilized to of course, learn about their prior engagement, their prior work. We, of course, feed this data before and then do better trend analysis and pattern analysis of what kind of activities and areas are where they will be able to best contribute in within, of course, the constraints under which they are working. And then, of course, we explore the identity further with these business occupations within the multi-purpose cooperative that they will be part of. Again, there are several collectives within the multi-purpose cooperative, either area-based or occupation-based. So we need to definitely zero down on that as well. And then, of course, with the documentation and examining the finance-related issues, we are able to provide them the credit and the support needed for enhancing their business operations. Yeah, I'll probably not go into details already, but maybe if there are any questions, we'll come to that. But broadly, the results and recommendations, we found that the AI and the platform or the business app was definitely able to improve the operational efficiencies as again also reiterated by Professor Dongre yesterday in the keynote, we were able to automate several administrative tasks that used to be very laborious and time-consuming in nature. The cooperative was able to also enhance its ability to provide credit based on the scorings and improve the financial inclusion of some of these informal workers. Digital platform, the business app itself, and the ways in which we engage with them on WhatsApp and other kinds of platforms, they were able to expand their market access and, of course, increase the member engagement as well. There are broadly some 3 or 4 recommendations that we have going forward. And of course, we, with the help of several stakeholders, will be working on trying to adapt and adopt these recommendations as well. But we definitely need, as always, the law and the reforms that we need remain the main issue, the enabling environment that is needed to simplify cooperative laws. For in India still, of course, past few years, maybe a decade or so, we have seen the advent of cooperatives in the service economy, but largely, if you look at the GDP of the country, while services is the largest contributor to the GDP, it's mostly agriculture or maybe sometimes industry/manufacturing where cooperatives are largely present, be it the sugar factories of Maharashtra or be it the fertilizer cooperatives and dairy cooperatives that we've of course been talking about for several decades now. So our attempt here is to try and sensitize the government, the policymakers, the stakeholders of the opportunities that exist in the services economy for cooperatives, and maybe a multi-purpose cooperative for that matter, which is not very traditional in its approach and one product or one commodity or one service focused, but could enhance the lives and livelihoods of members through different purposes. Of course, we provide the financial incentives and provide subsidies for some of these cooperatives to start, founding themselves in giving that first kind of support to make sure that they are able to adopt these digital solutions, which can be sometimes very tricky for these kind of audiences and segments to work with. Of course, capacity building is a key recommendation. We feel that digital literacy programs for cooperative members is key. And of course, the technical partnerships with fintech firms, corporates, private sector, and of course, the AI specialists in particular is very important if we are talking of making sure that the cooperative movement does not lose this opportunity and traction that we are seeing in the industrial revolution 4.0 or 5.0 these days, as we say. Lastly, my conclusion, the implication for stakeholders and what's the application impact of this research. We feel, as I just mentioned, policymakers, NGOs, informal workers, we've identified them as the key stakeholders to start with and make sure that there are policies available, there are grassroots networks that are able to incentivize such kind of work where digital platforms and AI can penetrate into cooperatives in the urban settlements as well. And of course, the fact that informal workers, we need to see how can we strengthen their collective action, provide the voice and also the advocacy and policy needed to influence change at the larger level. And of course, future research with the help of excellent academia, colleagues, friends already here. Maybe we can work together on assessing the scalability of the AI-driven cooperative model. Really, these are early days for such a platform. So what are the kind of multitude of issues that could be presented in the urban context where already some very different kind of organizations are working? And of course, explore the long-term financial sustainability of such a multi-purpose cooperative model. So those are the broad things that I would like to leave you with. And of course, happy to answer any questions, be in touch and see how we can work together to scale this potential model and enrich the lives and livelihoods of our informal economy workers. Thank you so much. Over to you.
Thank you so much, Mohit, to bring into light such an innovative project which you have taken up. I now invite my experts to please ask your queries.
Mohit, really, it's an innovative thinking. In fact, the business gym. Are we drawing this one from any other experience or examples from other parts of the country? There are 1 or 2 examples we can also quote from Kerala, that app-based platform cooperative is there. And in Tamil Nadu also, there is one society which is having an auction system by using this app-based system is there. Like that, whether we are drawing lessons from those people and then coming out with our own gym, business gym. This is one thing. Second one is that you have broadly you have said that you have collected literatures and discussed with those people. Then what is the ultimate result you got from them? Basically for the research purpose only. But I don't know whether it will have much influence on the project which you are talking about, right? That numbers are what is the result, what we put forth before them, and what they have given reply. That we can just come out with that. And sometimes we can call this as labor contract cooperative society or gig workers. Is that related to that?
Sure.
No, please.
Yeah, that's it. Thank you so much.
And another important thing I want to regarding the cooperatives contribution in GDP.
Right.
Because during the policy discussion also, this was a very big debate among the policy makers, and also they had the Water and Cooper consultant was also there. Just they came out with the data which could not be substantiated, whether it is true or not. They say that it is around 78%, but it was there is no substantial evidence to prove that it has got. The contribution is 7 or 8%, and roughly now they say 2 to 3% only. And that also we cannot be able to prove, whether it is in agriculture sector or in the other services sector. There is no full proof for that. And of course, now we say that the cooperatives contribution in GDP by 2047 must be double digit. And that scientific calculation must be that. This is out of your paper. Since you came out with the contribution of cooperatives in GDP, I thought that I will just have a word on that. Thank you.
Right. Thank you so much, Dr. Pichai. I'll try my best to address the broad four areas that you've highlighted. One, of course, learning from the best practices. Yes, we were looking at both national and global cases, wherever we will have some kind of very similar contexts and best practices cases that we can adopt and adapt rather than reinventing the wheel in many ways. And we probably also mentioned it in the full paper, at least 3 countries that we could get this fairly similar, maybe in a different context, but still. One, of course, is the one in the US, where they have these home care health workers in New York, especially. And in fact, they've been doing fairly well. Of course, it's just a city and it's just one occupation, but it's a fairly well-run organization. So that's one cooperative that we had studied a bit more in details and mentioned in the full paper. Also, couple other examples did come to our mind from UK and Canada. But again, I must confess the complexities with which we work in Indian urban contexts, the density of population, the mirage of migrants that we have been working with. So there are issue of identity, issue of self-awareness, and of course the livelihoods. And sometimes some of this has to be in conjunction with their very current urgent needs. Some of this cannot wait for some of this research and analysis and others to happen. So while working in parallel, of course, a couple of examples that we adopted from the drivers cooperative in New York, the also the Kerala-based and the Tamil Nadu-based auction platform, and of course in India also some very interesting things are happening these days with the ONDC also coming up and trying to provide a platform. The GEM portal has also been there around for a long time. So we're trying to see basically how do we ride the IT wave, the technology wave, the upcoming AI wave as well. So trying to see what are the avenues out there, and of course cooperatives looking at how they, Professor C.K. Pralhad, I'm sure some of you would have already read him. He, in very beautiful words, puts across how the fortune lies at the bottom of the pyramid in one of his very reputed books. So we are trying to utilize those theories and models of cooperative organization and democratic organization to try and work with the bottom of the pyramid and enhance their understanding, capacity, awareness of digital platforms, of course, with the AI and ML and other kinds of tools that are available now, but to make sure that they are able to do their business better. We don't want to create new problems for them. We don't want to look for new problems for solutions that already exist. We're just trying to find the needs that these urban informal workers have for now, men, women, and of course all classes, and try and address their issues as well as possible. But definitely point noted on trying to look at the Tamil Nadu and Kerala models also very closely. The ultimate result, just in terms of this lens and landscape of the research, was indeed to go and better understand the existing models. Sometimes also what happens is, especially NGOs, in all honesty, can be fairly donor driven as well. Sometimes it's a donor, let's say a Godrej and Boyce or an HCL Foundation or XYZ CSR organization, can be anything. They might have certain, criteria and some of these goals and objectives that are laid out. And sometimes organizations, NGOs, community-based groups can probably be working on those landscapes also. So I think in my personal research trajectory for this work, the ultimate result was to make sure that how sustainable or not this setup, this community-based work could be. Is it just about a certain timeline until which a fund is available and hence they are working on this aspect? Or is it very much bottom up and not so much top driven? So those were the areas which I was trying to prong in details. Maybe it didn't come very well in my presentation now, but I'll make sure I'll also incorporate it in the full paper later. But yes, the results were that we were able to analyze and finalize that, this is a very bottom up kind of sustainable cooperative model. These people do understand the issues related to their needs and the local aspirations that they have, and they are able to collectivize and better understand the cooperative model also. Of course, a lot of training and background has gone into making them realize why is the Amul model so famous, what happened to those women workers who were draining that X liters of milk every day, and how these dividends has able to enhance their livelihood. So those things have gone behind, and a very bottom-up approach has been the result of my primary data and secondary data research of this this analysis. Thirdly, I think you mentioned about gig workers. We do see this as a possible element within this research come application going forward. I must confess it's not already the key focus area or the founding issue that we are working on. The founding issue is to give dignity to the informal workers and formalize them in urban settlements. There could be people who are working on gig economy. There could be the Zomato drivers, Uber, Ola drivers, Swiggy drivers. We'll probably be working with them also. But that's one of the occupation collective amidst a myriad of activities and collectives that the multi-purpose cooperative in general will be looking at. So point well noted on trying to see also, because gig economy and its work is also in the limelight. And I think recently the Niti Aayog also has addressed this issue at the national level, that this is a area of interest to them nationally, and how we would make sure that they are also able to contribute to the economy and society in more ways than one. So that's well noted. And lastly, yes, the point about contribution to the GDP itself. Yes, this also comes from those aspects within the country analysis, but maybe also a bit from the personal insights and opportunities I had in my previous work. So for instance, just for the benefit of the audience also, I had the opportunity to work on a project which enhances the GDP contribution of cooperatives in the UAE, and working very closely with the Ministry of Economy there. So we were able to see, and of course they had some very ambitious targets. They were at 0.5% to the GDP, and within about a period of 7 years, they wanted to reach 5%. And the biggest cooperative that they have, the likes of our Amul for that matter, is called a Union Co-op. It's a super bazaar, it's a supermarket. As you would know, UAE, Dubai, it's mostly about the retail industry. It's about the malls and fashion and other things. So I think we were able to better discuss and understand with them, and did see the aspect of technology, how it's, and these days, I don't know if any household here in this room here is not aware of an Amazon or a Flipkart, or does not get products or services delivered by them. Similarly, they also, within the UAE context also, they had their own supermarket, this Union Co-op, which was run and managed by cooperative members. Of course, fairly affluent one, not very contextually to the Indian system that we have here. We of course have consumer stores, but we have the the super bazaars or the Kendriya Bhandars and others. We are trying to see how can these informal economy workers collectivize and possibly at some stage
also have their own consumer stores and equivalent to an Amazon or a Flipkart, maybe 5 years, 10 years, 15 years down the line. We don't know yet. But we would definitely want to make sure that they also are able to participate in the formal economy and in the services economy, which is contributing largely to the GDP. And yes, we don't quite have a number yet. As Dr. Pichai mentioned, 5% or 2%. That's been an area of study for a long time. It's definitely a very complex study, and I'll also invite all our friends, young colleagues, scholars here to try and see if and how we can work together on this very interesting aspect. I'm guessing the NCUI had also tried to undertake such a study with the ENY, I think a couple of years back. But we will definitely want to try and organize these collectives, cooperatives, SHGs, and all kinds of larger under the cooperation among cooperatives umbrella, and have these multi-purpose cooperatives contributing to the services economy, and hence the through platforms, digital avenues, or otherwise to the largely to the GDP per se. That's definitely an ambition of this paper, of this research, of this initiative as well, of the business journal. I hope that addresses some of the questions and comments.
Just two points only, please. More than that. One is probably Moisji, you may be aware that Gandhigram made a small attempt on that area. Yeah. Even in fact, we came out with a model. Mr. Ganesh may also be remembering that. The Coop pitch at IIM Kozhikode, we made a presentation on this. Probably it's a small venture. We tried to come out with that. Now we are coming out with in a bigger way. Probably that's a great thing. Thank you.
Thank you so much. Yes, indeed, it was a great inspiration. We've been hearing about these cases outside. A lot of theory and discussion has happened. Some colleagues may also know there is this interesting organization called Platform Cooperative Consortium, led by Professor Trevor Scholes at the New School in New York. And some very interesting research and academic discussions happen under this larger umbrella. It has the Institute of Cooperative Digital Economy as well. So I guess some of these discussions are also coming from the learnings and insights from those areas. And of course, working very closely with the Gandhigram Rural Institute and Dr. Pichai's wonderful initiative on campus. Of course, we'll all be able to collaborate, cooperate, and work together in trying to provide the necessary scale and weightage to such initiatives to go further. Thank you. Thank you so much for your.
Thank you. Next, we have Dr. Bhumika Saroha, and she will be presenting on topic building bridges, breaking barriers, women and youth as architect of change in steering cooperative towards attainment of SDG. Judges, please make a note that Dr. Bhumika Saroha will be presenting next. Prior to that, Dr. R. Shamila was presenting, but now Dr. Bhumika Saroha will be presenting.
She's 11 now.
She is like, she was 9th number. Yeah, there it will be 11. Because yes. Yeah. Dr. Bhumika Saroha. Dr. Bhumika Saroha.
Very good afternoon, respected sir, ma'am, and my dear colleagues. Today I'm going to talk about building bridges, breaking barriers, where women and youth will be acting as an architects of change in steering cooperatives towards attainment of sustainable development goal. एक एक से सब बढ़ें, सब बन जाएं काम, नदी मिले सागर से, हो अटल आराम. With this profound wisdom of Kabir Das beautifully mirrors the essence of cooperative for the cooperative strength. India is the land of cooperation, so the land of cooperatives. Our culture is imbibed with the cooperation in social sector, economical sector, personal area, family life, and to the business acumen also, may it be textile, dairy, fisheries, handloom, handicrafts, etc. So we have a classic examples of successful cooperatives like Amul and Lijat Papad. But beyond this cooperative success, cooperatives play a crucial role in social empowerment. Today, we have more than 8 lakhs of cooperatives working in India in different sectors, and they have evolved not new. We have started in 1905 with the first credit cooperative society in India, then 1912 Montagu Chelmsford reforms, first 5-year plan, multiple state cooperative societies act 2002, and finally in 2011 it got the constitutional status under 97th constitutional amendment act, wherein it is the fundamental right under article 19(1)(a) to form cooperatives, and also added 43B in directive principles of state policy. And further, it was strengthened in 2021 with the formation of a dedicated Ministry of Cooperation. So we can see that we are following a Lindblom's incrementalism model. So we need to go more miles, but with the practical application aspects. Rules and regulations are there in the place. We can say that cooperatives are the member-owned enterprises that prioritize economic, social, and cultural objectives, but placing people above profit. The entire philosophy revolves around Vasudeva Kundakam, that is, the world is one family, which unites means cooperation. Few examples are Sadhana, that is an NGO in Udaipur. The women are working for textile, handicrafts, and handlooms, and they're selling through their 4 stores. It is Prabhavana, where the motto is Nari to Narayani, and it is working in the states of Andhra, Telangana, and Karnataka. It is a multi-state cooperative. SEWA, Lijjat Papad, and we all know the benchmark cooperative society in India, that is Amul. With this, we move forward to NCUI, National Cooperative Union of India, which was established a body for cooperative organization to unite, promote, and strengthen the cooperative movement by focusing on policy advocacy and cooperative development, training, education, strengthening dairy and agriculture cooperatives in particular and others also, financial literacy and inclusion. To have a look at the statistics, it is 25 plus women training programs in different states, 8 lakh plus cooperative, and to 90 million training centers, 1.2 lakh CRs of cooperative societies in different areas, and 10 lakh plus training being given to different youths. And it is working on the 7 basic principles, that is voluntary and open membership. There is no discrimination on any basis. Democratic member control, people come and they decide of their things. Members' economic participation, this is already decided how they are going to contribute and what is the share in the profits. Autonomy and independence without any influence from outside world. Education, training, and information to bring a collaboration of different cooperatives, and finally working for the community at large. And by focusing on these 7 principles, we are concerned about the values, that is self-help, self-responsibility, equity, equality, openness, social responsibility, and caring for others. When we look at these numbers, we say that in the age group of 18 to 25, only 25% of the women are working. But in the same age group, this number rises to 50%. To contrary, 26 to 35 years of age, the number for women is 40% and for men it is 84%. So with this, we can see there is lot of gender disparity or gap between the working women and male in the cooperatives. This is the issue which needs to be addressed to attain the sustainable development goals. Further, we say that 1.2 million women get married or girls get married before the age of 15, pushing them towards to more of household activities rather than allowing them to join and form the cooperatives to be financially independent. And if we look at the literacy rate, which is 77.5% for rural India, women constitute 70.4, but the male constitute 84.7%. It means there is a huge gap in the education sector as well. So we need to see that when we say these numbers talks about literacy rate, are they actually educated to form cooperatives or not? Literacy rate, we agree, this is the literacy rate, but that does not signify about the education and the skills which are required to be form a cooperative. So what we need to see at this level with these numbers, the basic challenges which are faced by women and youth is first the social condition, the perception of the people that women will not get into any kind of job or they will work, they will be confined to the four walls of the house. And for youth, the perception is this, that they will be going for the formal sectors, either services or big corporate house. Then there is lack of business outlook. They are working on their skills as a hobby, as a part-time things to earn small amount of money, not with a particular business models, and approach towards wealth creation is totally missing. They are doing it to for their own work or to suffice their families, not for the purpose of wealth creation. So we need to bring in this zeal among the youth and women that they have to be financially and skill based independent to decide the things. While looking at these figures, under this study, we have dual objective. First is the challenges which are faced by women and youth in living in the rural India. Second, the crucial role played by the cooperatives in exploring their contribution, challenges, and impact on socio-economic development. So basically, out of 17 sustainable development goals, when we are talking about this study, we are focusing on 4 sustainable goals. That is number 4, that is quality of education. We have talked about the difference in the number of literacy rate. Then the gender inequality that is happening in the terms of workforce which are contributing. And finally, the decent work and economic growth. We have gone through 32 research papers of SAGE, AMREN, UN, World Bank, Indian government, and we have gone for a Flourish software. We use a Flourish software to have a graphical and pictorial representation of which words pop up more and which we need to address. Secondly, we have done a thematic analysis of the 6 major problems which are being faced by the cooperatives. The first is in the area of education, which we have already seen a huge gap in terms of the literacy rate between the male and the female. We have to talk about the disabled people and the skill set which is required, what kind of education we are imparting. In formal sector, there is no education or very little education which is talking about cooperatives. Second is the employment. Employment, there is a huge gap between what kind of employment we are seeking and what we are getting. Most of the population is involved in the agriculture sector and rest are running for the services or the corporate area. They are not ready to form the cooperative society. So this area is not providing that much of employment opportunities. Rather, it has to be channelized. It has to be put in the mirror, in the face of it, that it should act as an employment provider, employment generator, rather than employment seeker. Next is the healthcare, poor sanitation conditions, high rate of malnutrition and infant mortality rate, early marriages and associated risk. There are social barriers, prejudices against the women and youth with regard to cooperatives, and there is a negative perception and prejudice with regard to cooperatives also. That is seen as a lower way or lower path of working. Then we need to access to finances. They are not self-sufficient. Women and youth is that age, they do not have their own finances. Family is not supporting. We do not have some specialized agency which is providing them the minimum finance to work with it. And finally, the skill trainings. There is a huge gap between the skills, what is required and what is not required. Still, cooperatives at few different states are talking about it, like Umang and Achal in Uttarakhand. We are talking about various jute productions in Arunachal. Then Gujarat, the state of cooperatives, where we have Amul. where we have Banas, we have Gujarat State Cooperative Bank. In Andhra Pradesh, Lepakshi, which is talking about the handlooms, handicrafts, and brassware. Then Andhra Pradesh Marketing Federation, Andhra Pradesh Cooperative Organizations. These are few examples where the cooperatives are working well and they are providing impetus to the cooperatives in the different areas of working. Recently, we are being seeing and index Niti Aayog State Development Index 23 and 24, where we see Uttarakhand and Kerala as the top performing states. And Uttarakhand is there because of its synergy effects of environment conservation with economic progress. And this is the first state which has started with the gross environment product. So it can act as a model state for different other states in India to bridge the gap and to attain the sustainable development goals. And if we talk about the overall score of India, that is 63.99% with 109 rank, although the rank has improved from 121 to 109, but the score of 63.99% put us in the category of performers. So still there is a long mile to go to be in the category of front runners, which has a score of 65 to 99, and the achievers with a score of 100. So now what work the cooperative societies have to do at the cutting edge level, at the grassroots level, so has to be very, very efficient, and it should become the face. People become aware, people become this, how they have to market. So the first point here is, when you are working for a cooperative society, it gives you a sense of accomplishment that you are doing something not only for self, along with self, you are doing it for others. And it also matched with the core personality trait of the youth and women of today, which they want to work efficiently but with full freedom. They don't want any barriers, they don't want any conditions within which they have to work. So we need to offer a job security. There are certain institutes which are giving MBA in this very particular area with a core package of around 15 to 20 lakhs. There are educational programs being run by NCUI. Some are purely dedicated to women, like 4 out of 41. Then we have to attract the youth in the terms of good economic profits, financial image, and work-life balance. For marketing, we have the skills, but the skills are confined to individual youths or individual women in their areas. So to market them, which is lacking there, NCUI has started initially a concept of NCUI Heart, on the concept of Delhi Heart, and that should be taken to all the corners of the country, to the different states with different specialization products. So when we come to the applicability part of this, like how NCUI can improve, or how NCUI can come in to have a practical applications of the problems which we are facing, and to be the face and to be in the nook and corner of the country where youth and women are themselves willing to come forward and form the cooperatives. First is the fusion of potential. Under fusion of potential, when the women has the traditional skills, they have to be combined with the modern skills of the youth to have sustainable development. Women will be working with their traditional skills within the confines of house or within the confines of local area or regional area if they face the mobility problem. And the youth will be there to market their products. Youth will be there to channelize their energy. Youth will be there to use the modern technology, whether it is media, whether it is AI, and whatever tool, social media they want to use. And NCUI here has to develop a leadership and entrepreneurial skill role to guide them to have sustainable ventures and to bring in synergy between women and youth, because there will be a difference in the mindset, age, generation gap, which has to be bridged to have a fusion of potential, and which will be unbeatable because it will be a combination of traditional skills with the modern outlook of the youth. Next is we are talking about the gig economy. Here, the employees are working on the temporary positions. They are not given any permanent positions. And with the Generation Z, it is contributing to around 2% of GDP. We can exploit these situations as a cooperative. We can train them. We can go to the rural areas and we can partner with the digital platforms. And also, we can give the options to the youth and women to work on this in the part of gig economy as an additional, as a part-time job to start with, and finally then enter into the main course. And next is the rural tourism. This is the booming sector during the COVID and the post-COVID era. Okay. Then the Earth 11 is an initiative taken in Delhi by Ashish Sharma, which is talking about Panchakarma therapy, ancient healing with the modern technology. In Kerala, we have homestays and the tourisms, water sanitation. Rajasthan, we are talking about Sustainable Development Goal 3, 6, and 13. Next, we have to build in local capability centers where they are self-sufficient in terms of monetary as well as skillful. They are independent and they do not seek any help from outside. And they're working on the ask principle, like ask for what you want, seek out the opportunities and knock the doors. You make a group and you knock the doors. Then finally, it is the economic outlook where one district, one product in Uttar Pradesh, one district, two products in Uttarakhand, some specialized products of J&K, northeastern region. And finally, when with the actions and contributions of numerous organizations at national and international level, India is marching towards a new dome. Everyone is cooperating to build a new India where the cooperatives have to focus on each word of cooperative. C stands for competitive, O for operational efficiency, O outlook for self-sufficiency, P people-led, E entrepreneurship of women and youth. Resources are pooled, which are attainable, technology-led, initiative-oriented, vision-based, and self-employment generation. So while NCUI is focusing on this, we have to be abide by the words of our honorable PM, that is Sahakar se Samriddhi, prosperity through cooperatives, to have the all panchayats linked by PACS by 2029. And we are focusing on education. We are focusing on youth, as we all are sitting in the first youth conference organized by NCUI, marketing, and in international arena, we are observing the International Day of Cooperatives for year 2025, themed Cooperatives Building a Better World. In the end, I would like to conclude with the saying of former UN Secretary General, Mr. Kofi Annan. In the age where community involvement and partnerships with civil society are increasingly being recognized as indispensable, there is clearly a growing potential for cooperative development and renewal worldwide. Thank you.
Thank you so much, Bhumika. I would now request our jury to ask any question if they have.
Dr. Bhumika, you have come out with a very good presentation, and also you have collected literatures from different sources. That is one thing. Second one is that you have given a very good roadmap for the NCUI. Yeah. And another explanation, for cooperative, it's your own attempt, for cooperative, the expansion which you have given for each alphabet.
Yes, sir. It's my own. It's my own.
It's a good thing.
Thank you so much. Ma'am has a question. Compliments Dr. Bhumika for the comprehensive presentation covering, you started with what we saw initially. You mentioned about the ledgers and the name was there. It was there in your presentation only?
Which name, ma'am?
The ledger story, ledger papad.
Yes, ledger papad, Amul, Umang. Yes.
Okay. So I must say it was very comprehensive, starting with some successful cooperative story.
Yes.
And then we could see you are moving and covering states. Particularly when you were mentioning about Uttarakhand, it was very nice to hear, since I come from Uttarakhand. That's my Janam Bhumi, Delhi is my Karam Bhumi. So I must say it was very comprehensive, right? Now, what I want to ask you is that we could see you have made a matrix kind, some challenges, right?
Yes.
So what is the most important challenge
you faced when you conducted this study?
Ma'am, the most important challenge is to convince people that cooperative is something which can give you profit and financially sustainable. They are like कि इससे कुछ नहीं होने वाला. The income is not sustainable enough to have a economic empowerment or livelihood.
So the perception challenge, you mean to say.
Perception challenge.
How did you overcome it?
Ma'am, initially we have to convince them and give them certain success stories. Especially women are more connected towards women because their confines is the same. I told them this Lijat Papad started from rupees 80 to 16,000 crores of business. Amul is also a classic example. For more, this rural tourism is going too much in the mountain region in the northern India, like Uttarakhand and Himachal, even in the small hill stations of Haryana. We have a small hill station with the name of Morni Hills near Panchkula. And these villagers also started with this rural tourism. Their children put it on the social media or websites, and the ladies cooks, and they have that traditional cuisine and handicrafts, and you can go and stay there for some time.
So you see the challenge is the perception challenge about the cooperative, and overcome is sharing the successful stories.
Yes.
That's one way
Yes,
one can
ma'am.
overcome it.
Ma'am, we need to build an image.
An image
that,
building.
that where you feel proud that you're working for a cooperative, and it will give you some profit. It will give you a good financial stability to you and to the members who are working there.
Okay.
That is the only challenge. Legislation is being made by the government. We can improve. We are improving from 1904 to 2021. So we need to go another milestone, but we have to follow the Lindblom's incrementalism model. Small
They
things
can be-
every time.
So then one of the, Dr. Shrija, outcome of the conference can be, let us have some paper on about the image building for the cooperative. You know,
Sure,
if there have been certain papers, maybe we can take input from there, and the youth, because we also need to have a, like yesterday I mentioned the POE, the plan of action, specifically for the cooperatives, some research work can be done specifically focusing on just image building.
Like youth have a craze for cooperatives and civil society. We need to get them craze inside them of their own.
Create craze, right?
Yes.
Ma'am, actually, when I joined NCUI, the very first project which I took was to judge the aspiration and the willingness of the youth to be in this cooperative. Okay, that study we have done, we have come with the paper also. But when we talk about image building and knowing that whether people are having this cooperative as a good livelihood source or not, it's a difficult thing. It will take some time, at least a year, because now with the advent of ministry, there are so many initiatives, and university cooperative is at the forefront now. Everyone now these days know what cooperative is. So yeah. At least this awareness has been generated. So like one more year we can wait and then we can start the study. But yeah, in the initial phase we can do that.
One of my suggestions, we are having representatives from different regions, academic institutions. So like yesterday, I got students from my college, Sri Ram College of Commerce. Today, we have another student from Amity University. We can have, and others are coming now. So some international students are coming. They're just joining in. Can we have some, we talked about the image building, some cooperative ambassadors, right? In different, for instance, we have one here. We had a team from different colleges yesterday. So let's have similarly, like you are associated with some institution. So please think about it. Can we have some youth as cooperative ambassadors?
We are doing this in our Coop Connect program, and specifically when we go to advertise our LMS portal, which I'll be dealing here also. What we do, amongst the batch, we appoint one. Okay, and now we follow that person. Okay, what kind of programs are you doing? What are you? But that also need motivation, and we need that kind of program. NCUI has that institution. We have Coop Connect program which is going on, and then we also take up different programs under NCRT division. So of course we can come up with
Are there?
we are doing it already. So yeah, we can keep on doing. Yes.
He takes it to his university, what you are doing.
Actually, we keep on going to different university, but yeah, and we appoint a person.
A lot.
Yes, we are doing it already. But yes, we can do in collaboration. That will increase our outreach.
Absolutely.
Yes. He is a student in my meeting.
Amit.
Okay, great. Yeah, ma'am.
They are not members of the CRT IFCO Cooperative Research Team. So
Okay.
in fact, others are also welcome to join us. You know,
Sure,
let's
ma'am.
join hand. You mentioned about the C's.
Yes,
So-
ma'am.
So I also believe in 3 C's: connect, cooperate, and collaborate. So one of my students asked me to add another C to it, celebrate. Okay, let's. That's also important.
Thank you so much, ma'am, for your insight, and thank you, Bhumika, for your presentation.
Thank you, ma'am.
And now we have Mrunal Karkhile, and she will be presenting on topic the role of cooperatives in SDG implementation and making India a $5 trillion economy. Welcome, Mrunal, and all the very best.
Good afternoon, everyone. My name is Mrunal Karkhile. I am Cooperative Relation Officer in IFCO. So my today's topic is role of cooperatives in SDG implementation and making India a 5 trillion economy. So let's begin with the core idea of today's discussion. I will cover the role of cooperatives in achieving SDGs and how IFCO is contributing in achieving these SDGs. Then impact of cooperative on Indian economy and world economy. Then some challenges and opportunities in cooperative sector and some recommendations. So I have used mixed method approach, literature review, qualitative data, some interviews with cooperative managers, stakeholders, and qualitative data, financial and operational analysis of cooperative, then some case studies. So first of all, I will discuss about the cooperative share in Indian economy and world economy. After that, I will discuss about why cooperative is the best model for the implementation of the SDGs. So I have recently read one report by the Primus members, which is a management consultancy firm, which says that Indian cooperative sector has immense potential to generate the employment. The report also says that Indian cooperative sector generates 5.5 crore direct jobs opportunities and 5.6 crore self-employment opportunities by 2030. And also, according to the Indian Cooperative Movement report, in 2006 and 7, 13.3% of total employment in the economy was generated by the cooperative sector, and in 2007 and 8, the 1.2 million increased job opportunity due to the cooperative sector, and in 2016-17 there are 5.8 million job opportunity was generated by the cooperative sector. So you can see the 18.9% of annual growth in due to the cooperative sector. So, talking about the cooperative share in Indian economy, nearly 20% of total agriculture credit of the country is dispersed by the cooperative sector, 25% of fertilizer production, 35% of fertilizer distribution is done by the cooperative society, then 31% of sugar production, more than 10% of milk production, more than 13% of procurement of wheat, 20% of procurement by paddy, and more than 21% of fisherman business is done by the cooperative sector. So this number itself shows that how cooperative is helping in making India a $5 trillion economy. Then moving towards our next question, that is how cooperative is the best model to apply or to implement these SDGs. So as we all know, there are 30 lakhs cooperative society in all over world, and out of which 30% cooperative societies are in India. So I will give you one example of my organization. As you all know, IFCO has started its journey on 3rd November 1967 with just 57 members, and now we have 35,667 member cooperative societies, and that society are connected with nearly 50 million farmers. So cooperatives are the only organizations that are connected with the grassroots level people, and that are connected with the rural people and the farmers. And for the development of overall country, we need to develop. We need social and economical development of the rural people and the farmers. So I will just let you know about the SDGs. So SDGs, also known as global goals. There are 17 integrated and interrelated goals to end the poverty, protect the planet, and ensure that humanity enjoys peace and the prosperity by 2030. So my next slide is cooperatives in SDG implementation. So I will focus on how IFCO is implementing this SDG in our day-to-day operations. So for poverty and inclusive poverty reduction and inclusive growth, IFCO has distributed nearly 2,500 doors to the youth and to the farmers so that they can earn additional income. Then IFCO, through its subsidiary called IFCO Kisan Finance Limited, they have dispersed 546 crore of loan in during the year 21-22. And you may be aware about the IFCO Yuva portal, which empower the rural youth and promote the skill development in rural areas. Then zero hunger, second SDG, zero hunger and food security. So this is the main SDG. Because of that, IFCO has established. So मैं यहाँ पे एक स्टोरी बताना चाहूंगी. जब ग्रीन रिवॉल्यूशन हो रहा था तो उस समय फूड सिक्योरिटी की प्रॉब्लम हो रही थी. तब हमें हमारे पास इतना इनफ फूड नहीं था कि हम लोग पूरा हमारी कंट्री को फूड सप्लाई कर पाए. So that time IFCO has taken initiative. Then we have established two fertilizer plants, one at Kalol and another one is Kandla. तो उस टाइम क्या होता था कि लोग ऑर्गेनिक फर्टिलाइजर्स यूज करते थे, तो उसकी वजह से प्रोडक्शन कम होता था. तो हमें लोगों को इंसिस्ट करना पड़ा कि आप ये केमिकल फर्टिलाइजर्स यूज करो. बिकॉज ऑफ दैट प्रोडक्शन प्रोडक्शन इंक्रीज हो जाए और हम लोग अपना एटलीस्ट अपनी कंट्री की फूड सिक्योरिटी की प्रॉब्लम सॉल्व कर पाए. After that, we have not only solved the food security problem, but अभी हम लोग अपनी इंडिया कंट्री की फूड सिक्योरिटी प्रॉब्लम सॉल्व करके हम बाहर भी अपने प्रोडक्ट अपने जो फूड है वो हम लोग सप्लाई करते हैं. Then coming towards good health and well-being, IFCO has established IFCO Kisan Seva Trust in 2000, which provide medical assistance and disaster relief to the poor farmers. And we are also providing scholarship to the students belonging to the family from small and marginal farmers. The next, quality education. IFCO also ensures that quality education by providing students, by providing scholarship, and we also arrange promotional programs to educate farmer on the balanced use of fertilizer, soil testing, soil rejuvenation, and application of biofertilizer. And for the gender equality, IFCO always encourage women to become the members. And our women members are actively participate in the decision making, and we have also reserved 5% of seats for the women in our representative general body. And we have also trained 300 women as a drone pilots, which are also known as drone didis under the Namo Drone Didi scheme. Then for the affordable and clean energy, our production units have always adopted the appropriate technologies and replaced energy inefficient equipment with the energy efficient one. So as we all know, on the 19th June, the United Nations General Assembly proclaimed 2025 as the International Year of Cooperative, which highlights the cooperative's vital role in sustainable development. So the official launch of this IFC 2025 was occurred on the inauguration of the ICA Global Cooperative Assembly, which was at Bharat Mandapam, New Delhi, and which was inaugurated by the Honorable Prime Minister of India, Narendra Modi ji. So what is the objective of IYC 2025? It's over the next 12 months, IC will work to increase the visibility of cooperatives and raise the public awareness about their contribution to sustainable development. So not only ICA, but our Ministry of Cooperation has also taken various initiatives during the ICA, during the IYC 2025. So first is IYC 2025 initiative taken by the ICA. So ICA has formulated a cooperative and mutual leadership circle, which is known as CM50, which is bringing the top cooperative leaders together from across the globe. And from India, it is very proud moment for us that IFCO, Amul, and HPSCB are the part of this CM50 circle. And for IOC 2025, Minister of Corporation has formed National Cooperative Committee to spread the awareness about the IYC, focusing on enhancing outreach, fostering inclusivity, and driving sustainable growth within the cooperative sector. Now, I will give you the brief idea that what, as being a world's #1 cooperative, what we are doing in the International Year of Cooperative. So first is increasing membership, member cooperatives. So we have started membership drive. We are going to increase our membership from 35,667 to the 40,000. We are going to focus on the states which with the fewer member societies. Then we have with the partnership with FRI Dehradun, we have also developed 6 new neem varieties. With the higher oil production and increase as a directory, so which will also provide the additional income to the farmers. And we are dedicating it to the nation during the IYC 2025. Then for strengthening the blue economy, we are expanding our Sagrika plant. So so this is going to empower the fisher folks and the fisher farmers, contributing additional income to 148 to 150 million rupees. Then after successful launch of our Nano Urea Plus and Nano DAP, we are going to introduce Nano NPK granule in 5 kg bags, which will be available to the farmer during the IYC 2025. And its objective is to reduce the fertilizer and use and promote environmental conservation. Then we have another initiative called Carbon Neutrality Initiative. We are going to achieve it by tree plantation. We are going to plant 10 lakh plants to offset the emission from our employees' travel and from our production units. Then we are also conducting monthly webinars to educate our members and to educate our employees regarding cooperative principle, governance, and SDGs. So this is all about. Then I have some recommendations. So as a youth, as you all know, more than 65% of Indian population is under 35 age, and India is one of the youngest country in the world. When I have conducted interviews with the cooperative managers, young stakeholders, and youth, who are often visit to our society, our organization, मैंने जब उनसे बात की तब उनको बस कुछ ही सोसाइटीज के बारे में पता था, जो जैसे कि अमूल है, अमूल, क्रिप्को, इफ्को, NCUI, NCDC, ऐसे कुछ कॉपरेटिव्स के बारे में दे डोंट नो अबाउट लाइक कि कितनी सारी टाइप्स की कॉपरेटिव बन सकती है. जैसे कि मैं रिसेंटली मैंने एक PhD चैम्बर में एक कॉपरेटिव समिट अटेंड की थी. वहां पे विक्रांत डोगरा जी प्रेजेंट थे, जो उन्नति एग्री अलाइड एंड मार्केटिंग सोसाइटी के चेयरमैन है, एंड श्री अशोक ठाकुर जी थे जो नाफेड के डायरेक्टर है. तो उन्होंने वहां पे बताया कि हाउ उन्होंने नाफेड 3,500 करोड़ के लॉस में थी नाफेड, देन उन्होंने कैसे उसको 500 करोड़ प्रॉफिट में लाया. देन विक्रांत डोगरा जी ने एक एग्जांपल बताया कि स्पोर्ट्स कोऑपरेटिव है, एक शिमला में एक काफी पॉपुलर है, जहाँ पे एक्सपर्ट्स आते हैं स्पोर्ट्स के रिलेटेड, और वो एक कोऑपरेटिव बनाते हैं और वो स्टूडेंट्स को ट्रेनिंग देते हैं. तो ये लाइक बीइंग अ पार्ट ऑफ द कोऑपरेटिव, ये मुझे नहीं पता था कि ऐसी भी कोऑपरेटिव बन सकती है. तो और अभी मैंने रिसेंटली एक बायलॉ पढ़ा कि फिल्म प्रोडक्शन की भी कोऑपरेटिव बन रही है, जो बॉम्बे में अभी बन रही है, उसके बायलॉज आए थे, तो मैंने वो भी पढ़े. और ऐसे इवेंट मैनेजमेंट की, मतलब जो वेडिंग प्लानर्स है, उनकी भी कोऑपरेटिव बन सकती है. जो मतलब ऐसे जो यूथ के पास आइडिया है, मुझे लगता है उसके लिए एक प्लेटफॉर्म होना चाहिए, जैसे कि लोग वहां पे आए और यूथ आए और अलग अलग आइडियाज दे, अलग अलग कोऑपरेटिव के बारे में सोचे, क्योंकि मिलियंस ऑफ माइंड से मिलियंस ऑफ आइडियाज आ सकती है. एंड हमें यूथ को ज्यादा इंस्पायर करने की जरूरत है कि टू स्टार्ट द कोऑपरेटिव, एंड फॉर दैट आई थिंक एक कोऑपरेटिव इकोसिस्टम डेवलप करना बहुत जरूरी है. For that, I think गवर्नमेंट को थोड़ा यूथ कॉपरेटिव्स को और प्रमोट करना चाहिए। तो वो कैसा कर सकते हैं? तो एक जैसे कि ग्लोबल एंटरप्रेन्योरशिप वीक होता है, ऑल कॉपरेटिव वीक भी होता है, ऑल इंडिया कॉपरेटिव वीक भी होता है, वैसे एक यूथ कॉपरेटिव वीक भी हो, जैसे कि जहाँ पे सारे यूथ कॉपरेटिव को एक साथ आने का मौका मिले और उससे वो नेटवर्क और कोलैबोरेशंस भी हो। जो बड़े बड़े कॉपरेटिव है, इफको, अमूल, उनसे लार्ज कोऑपरेटिव उनको हेल्प करे, उनको गाइड करे। तो that's all of it, and these are my recommendation. Thank you so much.
Ms. Mrinal, it's a very good paper you have come out with, and you have come out with what are all the initiatives or what are the activities the IFCO is doing under sustainable development goals. Only one thing you can add, what is the impact it has created among the members? That is one thing. Second one is that if possible, if you would have come out with cases. You have just explained now, but it should be in the paper also.
Yes, sir.
That would give strength to your paper.
Okay, sir.
Thank you so much, Mrinal.
Thank you so much, ma'am. Thank you so much, everyone. And thank you so much, NCUI, for arranging this conference. We are really happy to be here.
Thank you. So this is the end of technical session 2. I would like to extend my heartfelt gratitude to all the experts, judges, and all the participants who spoke today. It was a very enriching experience for all of us. We'll now break for lunch, and after 1 hour, we'll start the third technical session here only. And after the technical session, we'll have our bi-directory session, okay? But before that, we'll have a session on social media handles of NCUI, like 10-15 minutes, and then we will have bi-directory, and then you can leave for your places. So yeah, please break for lunch. Thank you so much.
So I just wanted to compliment, what's your name? Mrinal. Mrinal, it was a very good presentation and particularly very relevant to the theme. We are having a conference on cooperatives and SDG, and you could map the IFCO's initiative to the different SDGs. That was very well done. Congratulations.
Actually, for your reference, Mrinal, we both have written one paper on how daily cooperative is ticking all the boxes of SDG. I want to tell you one thing. Okay, the presentation was qualitative. For every SDG, what we did, that we have had some qualitative data. We have proved that Amul as a model is doing that. Some 10 years data, some 5 years data. For every indicators, we have done that. That is missing. That you can augment, and then you can come up with a very good paper.
We'll do one thing. We'll share our paper with you.
Yes.
You already have the information. So what is required for a good publication in a properly Scopus indexed journal is some quantitative analysis is required, right? So we'll share that paper where you can map. You have mapped already the SDGs with the activities being undertaken. Now, if you take some data and then you map it, apply some statistical technique, then you have an opportunity to get it published. I think it was published in the internationally refereed journal.
Yeah.
So Sanjay sir can also help with the publication. So we'll share a paper with you. You work on this similar information and Sanjay sir will help us. Sanjay sir, you'll help us, huh? I take the promise. That's the motivation for youth, to work forward.
Thank you, everybody. Please break for lunch.